Thank you. We had a lot of technical issues. We never had it before. Well, that sums up how 2020 is actually. Yeah, we'll go on with the program. ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ, ಮತ್ತೊಮ್ಮೆ ಸ್ವಾಗತ. ನಮ್ಮೊಟ್ಟಿಗೆ ಇವತ್ತು ಶೋನ ಹೋಸ್ಟ್ ಮಾಡ್ಲಿಕ್ಕೆ ಪ್ರತಿಭಾ ಶಾಂಶಿಮತ್ ಇದ್ದಾರೆ. ಐ ಆಮ್ ಶೋರ್ ಶಿ is very well known personality in Karnataka, not only in Karnataka, in India and in Asia. Pratibha Shanshimat was the first in South India to be crowned as Mrs. India, first Kannada married woman to hold an international beauty title as Classic Mrs. Asia International, Mrs. Photogenic 2015. She is currently the director of Mrs. India Karnataka, regional director of Mrs. India, model and actress, having appeared in more than 30 ads and 2 short films. Welcome to the show, Pratibha avare. Namaskara, nimಗೆಲ್ಲ ಸ್ವಾಗತ.
ನಮಸ್ಕಾರ ಡಾಕ್ಟರ್ ಮೋಹನ್ ಅವರೇ, ತುಂಬಾ ಧನ್ಯವಾದಗಳು ನನ್ಗೆ ಈ ವೇದಿಕೆಯಲ್ಲಿ ಕರ್ಕೊಂಡ್ ಬಂದಿದ್ದಕ್ಕೆ. ಯಾಕಂದ್ರೆ ಇಲ್ಲಿ ನಾನು ಹೇಳ್ತಾ ಇರೋ ಹಾಗೆ ಒಂದೇ ಟೈಮ್ ಎಷ್ಟೊಂದು ಡಾಕ್ಟರ್ ಸಿಗ್ತಾರೆ ನಮ್ಗೆಲ್ಲ ಪ್ರಾಬ್ಲಮ್ ಸಾಲ್ವ್ ಮಾಡಕ್ಕೆ. ಸೊ ಜನರಲ್ ಆಗಿ ಆಂಕರ್ ವತಿಯಿಂದ ಈ ಸ್ಪೆಷಲ್ ಅಂದ್ರೆ ವಿಶೇಷ ಮಧುಮೇಹ ಪಂಚಾಯತಿಗೆ ನಿಮ್ಮೆಲ್ಲರಿಗೂ ಸ್ವಾಗತ. ಇದು ಡಾಕ್ಟರ್ ಮನೋಹರ್ ಹೇಳ್ದಾಗೆ ವರ್ಷ ಅವ್ರು ಮಾಡ್ಕೊಂಡ್ ಬರೋ ಕೊನೆ ವರ್ಷದ ಅಂತ್ಯದಲ್ಲಿ ಮಾಡ್ಕೊಂಡ್ ಬರೋ ಅಂತ ಕೆಲವು ಕಾರ್ಯಕ್ರಮಗಳು ಈ ವರ್ಷ ಆನ್ಲೈನ್ ವತಿಯಿಂದ ಎಷ್ಟೋ ಜನಕ್ಕೆ ರೀಚ್ ಆಗ್ತಾ ಇದೆ. ಇವಾಗ ಈ ಪ್ಯಾನೆಲ್ ಡಿಸ್ಕಷನ್ ಆಗ್ಲೇ ಲೇಟ್ ಆಗಿ ಸ್ಟಾರ್ಟ್ ಆಗಿರೋದ್ರಿಂದ ಈಗ ಬೇಗ ಮಾಡ್ಕೊಂಡು ಹೋಗೋದು ನಮ್ ಕರ್ತವ್ಯ. ನಾನು ಮೊದಲನೇದಾಗಿ ಶುರು ಮಾಡೋದು ಈ ಮಧುಮೇಹ ಕಾರ್ಯಕ್ರಮ ಬಗ್ಗೆ ಆಸಕ್ತಿಗೊಂಡು ಇದನ್ನ ನಿಮ್ಮೆಲ್ಲರ ಮಟ್ಟಿಗೆ ತರ ಕಾರಣಕರ್ತರಾದ ಡಾಕ್ಟರ್ ಮನೋಹರ್ ಅವ್ರ ಬಗ್ಗೆ ಒಂದು ಕಿರು ಪರಿಚಯ ಮಾಡ್ಕೊಡ್ತೀನಿ. ಕಿರು ಪರಿಚಯ ಅಂದಿದ್ದು ಬಹಳ ಕಿರು ಆಯ್ತು, ಯಾಕಂದ್ರೆ ಅವ್ರದ್ದು ಇಷ್ಟು ಡೀಟೇಲ್ಸ್ ಇದೆಯಲ್ಲ, ಅದನ್ನ ನಾನು ಹಂಗೆ ಹೇಳಕ್ ಆಗಲ್ಲ, ಸ್ವಲ್ಪ ಓದ್ಬೇಕಾಗತ್ತೆ. ಆದ್ರೆ ಸ್ವಲ್ಪ ಬೇಗ ಓದ್ಕೊಂತೀನಿ. ಡಾಕ್ಟರ್ ಮನೋಹರ್ ಅವರು MBBS MD, ಫೆಲೋ ಆಫ್ ಯೂರೋ ಏಷ್ಯನ್ ಅಕಾಡೆಮಿ ಆಫ್ ಕಾರ್ಡಿಯಾಲಜಿ, ಎಡಿನ್ಬರ್ಗ್, ಗ್ಲಾಸ್ಗೋ ಮತ್ತು ಲಂಡನ್ ಇಂದ ಟ್ರಿಪಲ್ FRCP ಮಾಡ್ಕೊಂಡು FRSSDI, FTI ಮತ್ತು MNAMS ಮಾಡ್ಕೊಂಡಿದ್ದಾರೆ. ಅಷ್ಟೇ ಅಲ್ಲದೆ ಅವರು ಕ್ಲಿನಿಕಲ್ ಎಕ್ಸಾಮಿನರ್ ಆಫ್ MRCP UK, ಆರ್ಗನೈಸಿಂಗ್ ಸೆಕ್ರೆಟರಿ KRSSDI 2017ರಲ್ಲಿ, ಚೇರ್ಮನ್ ರಿಸೆಪ್ಷನ್ ಕಮಿಟಿ APICON 2018ರಲ್ಲಿ, ಫ್ಯಾಕಲ್ಟಿ DNB ಎಮರ್ಜೆನ್ಸಿ ಮೆಡಿಸಿನ್ 2019ರಲ್ಲಿ ತಮ್ಮ ಸೇವೆಯನ್ನು ಸಲ್ಲಿಸಿದ್ದಾರೆ. ಬರೀ ಸೇವೆ ಅಷ್ಟೇ ಅಲ್ಲ, ಅವ್ರು ಮಾಡೋ ಸೇವೆಗೆ ಅವ್ರಿಗೆ ಹಲವಾರು ಪ್ರಶಸ್ತಿಗಳು ಬಂದಿದೆ. ಅದರಲ್ಲಿ ಕೆಲವುಗಳನ್ನ ಇವತ್ತು ನಾನು ನಿಮ್ ಮುಂದೆ ಇಡ್ತೀನಿ. ಎಕ್ಸಲೆನ್ಸ್ ಇನ್ ಡಯಾಬಿಟಿಸ್ ಕೇರ್ RSSDI ವತಿಯಿಂದ 2018ರಲ್ಲಿ, ಕೆಂಪೇಗೌಡ ಅವಾರ್ಡ್, ದಿಸ್ ಇಸ್ ದ ಹೈಯೆಸ್ಟ್ ಸಿವಿಲಿಯನ್ ಅವಾರ್ಡ್ ಫಾರ್ ಬ್ಯಾಂಗ್ಳೂರ್ ಬೈ BBMP, ಇದು ಅವ್ರಿಗೆ 2018ರಲ್ಲಿ ದೊರಕಿದೆ. ರೈಸಿಂಗ್ ಸ್ಟಾರ್ ಇನ್ ಡಯಾಬೆಟಾಲಜಿ, ಇದು ಟೈಮ್ಸ್ ಆಫ್ ಇಂಡಿಯಾ ವತಿಯಿಂದ 2018ರಲ್ಲಿ ಬಂದಿದೆ. ಡಯಾಬಿಟಿಸ್ ಅವೇರ್ನೆಸ್ ಇನಿಷಿಯೇಟಿವ್ ಅವಾರ್ಡ್, ಇದು ಡಯಾಬಿಟಿಸ್ ಇಂಡಿಯಾ ವತಿಯಿಂದ 2017ರಲ್ಲಿ ಬಂದಿದೆ. ಇನ್ವೆಸ್ಟಿಗೇಟರ್ ಆಫ್ ದ ಇಯರ್ ಅವಾರ್ಡ್, ಇಂಡಿಯನ್ ಸೊಸೈಟಿ ಆಫ್ ಹೈಪರ್ ಟೆನ್ಷನ್ ವತಿಯಿಂದ 2017ರಲ್ಲಿ ಬಂದಿದೆ. ಡಾಕ್ಟರ್ ಮನೋಹರ್ ಅವರು ಮ್ಯಾರಥಾನ್ ರನ್ನರ್ ಅಂತ ಗೊತ್ತಿತ್ತು ನನ್ಗೆ, ಆದ್ರೆ ಅವಾರ್ಡ್ಸ್ ಮತ್ತೆ ಅಚೀವ್ಮೆಂಟ್ ಅಲ್ಲೂ ಮ್ಯಾರಥಾನ್ ರನ್ನರ್ ಅಂತ ಇವಾಗ್ಲೇ ಗೊತ್ತಾಗಿದ್ದು. ಇಷ್ಟೇ ಅಲ್ಲದೆ ಅವರು ಹಿ ಇಸ್ ವರ್ಕಿಂಗ್ ಆಸ್ ಅ ಡೈರೆಕ್ಟರ್ ಫಾರ್ GT ಫೌಂಡೇಶನ್ಸ್, ದಿಶಾ, CMES ಮತ್ತು ಆಕ್ಟ್ ಕಾರ್ಪೊರೇಷನ್. ಇಷ್ಟ ಅಲ್ಲದೆ ಮತ್ತೆ ಎಕ್ಸ್ಟ್ರಾ ಮ್ಯಾರಥಾನ್ ರನ್ನರ್ ಆಗಿ ಇವರು ಹಿಸ್ ರನ್ನರ್, ಹಿಸ್ ಅನ್ ಆಥರ್. ಎಷ್ಟೋ ಕಡೆ ಅವರು ನಮ್ ಡೈಲೀಸ್ ಅಲ್ಲಿ ಅವ್ರ ಆರ್ಟಿಕಲ್ಸ್ ಬಂದಿದೆ. ರೇಡಿಯೋ ಮತ್ತೆ ಟೆಲಿವಿಷನ್ ಗಳಲ್ಲಿ ಅವ್ರದ್ದು ಹಿತವಾದ ಮಾತುಗಳು, ಅವ್ರದ್ದು ಅಡ್ವೈಸಸ್ ಗಳನ್ನ ನಾವು ಕೇಳ್ಕೊಂಡಿದೀವಿ. ಡಾಕ್ಟರ್ ಮನೋಹರ್ ಅವರೇ, ನಿಮ್ದೇ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ನಮ್ ಕಡೆಯಿಂದ ನಿಮ್ಗೆ ಸ್ವಾಗತ. ಮನೋಹರ್ ಅವರೇ, ಒಂದು ಪ್ರಶ್ನೆ ಇದೆ. ಏನಂತಂದ್ರೆ ಈ ದಿಶಾ ಅಂದ್ರೆ ಏನು, ಇದರ ಕಾರ್ಯ ಏನು, ಇದರಿಂದ ವಿಷನ್ ಏನಿದೆ ನಿಮ್ಗೆ, ಅಂದ್ರೆ ಮುಂದೆ ಜನಕ್ಕೆ ಏನ್ ಮಾಡ್ಬೇಕು ಅಂತ ನಿಮ್ಮ ದೃಷ್ಟಿಕೋನ ಏನಿದೆ, ಒಂದು ಕಿರುವಾಗಿ ನಮ್ಮ ಪರಿಚಯ ಮಾಡ್ಕೊಟ್ರೆ ಒಳ್ಳೇದಾಗತ್ತೆ.
ದಿಶಾ ಅಂದ್ರೆ ಡೈರೆಕ್ಷನ್. ಇವತ್ತು ಬೆಳಗ್ಗೆನೂ ಒಂದು ಮೆಡಿಕಲ್ ಮೀಟ್ ಅಲ್ಲಿ ಒಬ್ರು ಸೀನಿಯರ್ ಡಾಕ್ಟರ್ ಸತ್ತೂರ್ ಅಂತಿದ್ದಾರೆ. ಅವ್ರು ಹೇಳ್ತಿದ್ರು ಸಂಸ್ಕೃತದ ಪ್ರಕಾರ 8 ಡೈರೆಕ್ಷನ್ ಇದೆ ಅಂತೆ. ದಿಶಾ ಎಲ್ಲಾ ಡೈರೆಕ್ಷನ್ಸ್ ಅಲ್ಲೂ ಬರ್ಲಿ, ಅಂದ್ರೆ ಬರೀ ಮೆಡಿಕಲ್ ನಾವು ಪೇಷಂಟ್ಸ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡ್ಕೊಂಡು ಪ್ರೊಫೆಷನಲ್ ಅಲ್ಲದೆ ಸೋಷಿಯಲ್ ಆಕ್ಟಿವಿಟೀಸ್, ಎನ್ವಿರಾನ್ಮೆಂಟ್ ಅಂಡ್ ನೇಚರ್, ಇವೆರಡು ಅಂಗಗಳಿದೆ ನಮ್ಮಲ್ಲಿ. ನಮ್ಮ GT ಫೌಂಡೇಶನ್ ಅವರ GT ಸುರೇಶ್ ಅವರು ನಮ್ಮ ಸ್ನೇಹಿತರು, ಆಕ್ಚುಲಿ ಅವ್ರು ನಮ್ಮ ಪೇಷಂಟ್ ಆಗಿ ಬಂದವರು. ಮತ್ತೆ ಇದೆಲ್ಲ ನಮ್ಮ ಸ್ನೇಹಿತರೆ. ನಾವೆಲ್ಲ ಸ್ನೇಹಿತರು ಸೇರ್ಕೊಂಡು ದಿನನಿತ್ಯ ಬರೀ ಮೆಡಿಕಲ್ ಪ್ರಾಕ್ಟೀಸ್ ಬದಲು ಏನಾದ್ರೂ ಒಂದು ಜನಸಾಮಾನ್ಯರಿಗೆ ಕೊಡುಗೆ ಕೊಡ್ಬೇಕು ಅಂತ ಅನ್ಕೊಂಡು ಈ ಸಂಸ್ಥೆನ ಸ್ಥಾಪಿಸ್ಕೊಂಡಿದೀವಿ. ಹಲವು ಕಾರ್ಯಕ್ರಮಗಳು ಮಾಡ್ತಾ ಇದ್ದೀವಿ. ಸೊ ವಿ ಆರ್ ಹ್ಯಾಪಿ ವಿತ್ ದಟ್ ಅಂಡ್ ಇನ್ನು ಮುಂದೆ ಹೆಚ್ಚು ಸಮಾಜ ಸೇವೆಯಲ್ಲಿ ತೊಡಸ್ಕೋಬೇಕು ಅನ್ನೋದು ಒಂದು ಉದ್ದೇಶ.
ಈ ಡಾಕ್ಟರ್ಸ್ ಅಪಾಯಿಂಟ್ಮೆಂಟ್ ಸಿಗೋದೇ ಕಷ್ಟ ನಮ್ಗೆ ಅನ್ನೋ ಟೈಮ್ ಅಲ್ಲಿ ನೀವು ಈ ಡಾಕ್ಟರ್ಸ್ ಬರೇ ನೀವು ವೈದ್ಯಕೀಯ ಅಷ್ಟೇ ಅಲ್ಲ ಇಷ್ಟೊಂದು ಕೆಲಸ ಮಾಡ್ತಿದ್ದೀರಾ ಅಂದ್ರೆ ಫುಲ್ ಹ್ಯಾಟ್ಸ್ ಆಫ್ ಟು ಯು ಆಲ್ ಡಾಕ್ಟರ್ಸ್. ಓಕೆ,
ಇದು ನಮ್ಮ ಟೀಮ್ಗೆ ಸಲ್ಲಬೇಕು. ಯಾಕಂದ್ರೆ ನಾವೇನೇ ಎಲ್ಲಾ ಐಡಿಯಾಸ್ ಎಲ್ಲ ಜೊತೆ ಕೂತ್ಕೊಂಡೇ ಮಾಡ್ತೀವಿ. ನಾವು ಸುಮಾರು ಈಗ 5-6 ವರ್ಷದಿಂದ ಹಲವಾರು ಕಾರ್ಯಕ್ರಮ, ಎಲ್ಲರೂ ಕೇಳ್ತಾರೆ ಬೇಜಾರಾಗಲ್ವಾ ಅಥವಾ ಇರೋ ಟೈಮಲ್ಲಿ ಮಜಾ ಮಾಡ್ಬೋದಲ್ಲ, ಸುಮ್ಮನೆ ಯಾಕೆ ಇಲ್ಲಿ ಮಾಡ್ತೀರಿ ಅಂತ. ಬಟ್ ಮಜಾ ಜೊತೆ ಇದನ್ನು ಸೇರ್ಸ್ಕೊಂಡ್ ಮಾಡಿದೆ. ಇದ್ರಲ್ಲಿ ಕೂಡ ಒಂದು ಸಮಾಧಾನ, ನಮ್ಮ ವೈದ್ಯಕೀಯ ಕ್ಷೇತ್ರದಲ್ಲೇ ಸಮಾಧಾನ ಹೆಚ್ಚು. ಅದ್ರ ಜೊತೆಗೆ ನಾವು ಸಮಾಜ ಸೇವೆಯಲ್ಲಿ ತೊಡಸ್ಕೊಂಡಾಗ ಬಟ್ ನಾನಾ ರೀತಿಯಲ್ಲಿ ಹೆಲ್ಪ್ ಮಾಡಿದಾಗ ಅದು ನಮ್ಗೆ ಒಳ್ಳೆ ನಿದ್ದೆ ಕೊಡುತ್ತೆ ಅಂತ ನಾನು ಅನ್ಕೊಂಡಿದೀನಿ. ಇದಕ್ಕೆಲ್ಲಾ ನನ್ನ ಸ್ನೇಹಿತರು ಸಹಕಾರ ಕೊಟ್ಟಿದ್ದಾರೆ. ಮನೆಯಲ್ಲಿ ಕೆಲವರೊಮ್ಮೆ ಬೈಕೋತಾ ಇರ್ತಾರೆ, ಬಟ್ ದೇ ಆಲ್ಸೋ ನೋ ಇಟ್ ಅಲ್ಟಿಮೇಟ್ಲಿ ಇಟ್ ಇಸ್ ಎ ವೆರಿ ಗುಡ್ ಥಿಂಗ್ ಅಂಡ್ ಎ ಬಿಸಿ ಮ್ಯಾನ್ ಹ್ಯಾಸ್ ಟೈಮ್ ಫಾರ್ ಎವ್ರಿ ಒನ್ ಅಂಡ್ ಎವ್ರಿಥಿಂಗ್ ಅಂತ ಅನ್ಕೊಂಡಿದ್ದೀನಿ ನಾನು.
ನೀವು ಟೈಮ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಅಲ್ಲಿ ಎಕ್ಸ್ಪರ್ಟ್ ಅಂತ ಗೊತ್ತಾಗಿತ್ತು. ಡಾಕ್ಟರ್ಸ್ ಜನರಲಿ ನಾವು ಮೆಮರಿ ಜಾಸ್ತಿ ಇರ್ತೀವಿ, ಯಾಕಂದ್ರೆ ಒಂದ್ಸಲ ಪೇಷಂಟ್ ನೋಡಿದ್ರೆ ಇನ್ನೊಂದ್ಸಲ ಇಷ್ಟು ಚೆನ್ನಾಗಿ ಜ್ಞಾಪಕ ಇಟ್ಕೊಂತಾರೆ. ಬಟ್ ಯು ಆರ್ ಸ್ಪೆಷಲಿಸ್ಟ್ ಇನ್ ಟೈಮ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಅಂತ ತೋರ್ಸ್ಕೊಡ್ತಾ ಇದ್ದೀರಾ. ಬಟ್ ಇಟ್ಸ್ ರಿಯಲಿ ಬಿಗ್ ಹ್ಯಾಟ್ಸ್ ಆಫ್ ಟು ಯು ಆಲ್. ಯಾಕಂದ್ರೆ ಬರೀ ಒಂದ್ ರೀತಿಯಲ್ಲಿ ಬರೀ ಡಾಕ್ಟರ್ಸ್ ದುಡ್ಡು ಮಾಡ್ತಾರೆ, ಹಂಗ್ ಮಾಡ್ತಾರೆ ಅಂತಾರೆ. ಎಲ್ರು ಒಳಗಡೆ ಹೋಗಿ ನೋಡಿದ್ರೆ ಗೊತ್ತಾಗತ್ತೆ ಅವ್ರು ಮಾಡೋ ಸೇವೆ ಎಷ್ಟಿದೆ ಅಂತ. ಆಕ್ಚುಲಿ ಅದ್ ಅರ್ಥ ಮಾಡ್ಕೊಳಕ್ಕೆ ನಿಮ್ಮಂತ ಡಾಕ್ಟರ್ಸ್ ಇಂದಾನೆ ಗೊತ್ತಾಗತ್ತೆ, ಯಾಕಂದ್ರೆ ಯು ಆರ್ ಟೀಚಿಂಗ್ ಔಟ್ ಟು ಪೀಪಲ್. ಸೊ ಹ್ಯಾಟ್ಸ್ ಆಫ್ ಟು ಯು ಆಲ್. ಅಂಡ್ ಲೆಟ್ಸ್ ಸ್ಟಾರ್ಟ್ ಆಫ್ ವಿತ್ ಇಂಟ್ರೊಡಕ್ಷನ್ ಆಫ್ ದ ಪ್ಯಾನಲ್ ಆಫ್ ಡಾಕ್ಟರ್ಸ್ ಹಿಯರ್ ಟುಡೇ. ಈ ವೈದ್ಯರು ಬೇರೆ ಬೇರೆ ಸ್ಪೆಷಾಲಿಟಿ ಫೀಲ್ಡ್ಸ್ ಇಂದ ಬಂದಿದ್ದಾರೆ. ಹಿಂಗಾಗಿ ಈ ಮಧುಮೇಹ ಅಂದ್ರೆ ನಾವು ಜನರಲ್ ಆಗಿ ಜನಸಾಮಾನ್ಯರು ಹೇಳೋ ಸಕ್ಕರೆ ಕಾಯಿಲೆ ಬಗ್ಗೆ ಎಷ್ಟೋ ಜನ ಏನೇನೋ ಐಡಿಯಾಸ್ ಇರುತ್ತೆ. ಆದ್ರೆ ಇವತ್ತೊಂದು ಚಿಕ್ಕದಾಗಿ ಎಲ್ಲರ ಕಡೆಯಿಂದ ಸ್ವಲ್ಪ ನಮ್ಗೆ ಅರ್ಥ ಮಾಡ್ಕೊಳ್ಳೋಣ. ಸೊ ಮೊದಲನೇದಾಗಿ ನಾನು ಪರಿಚಯ ಮಾಡ್ತಿರೋ ಡಾಕ್ಟರ್ ಸಂಜೀವ್ ರಾವ್ ಅಂತ. ಈಸ್ MD FRCP ಎಡಿನ್ಬರ್ಗ್ ಮತ್ತು ಗ್ಲಾಸ್ಗೋ ಅಂತ ಮಾಡ್ಕೊಂಡ್ ಬಂದಿದ್ದಾರೆ. ಪ್ರೆಸೆಂಟ್ಲಿ ಈಸ್ ಅ ಸೀನಿಯರ್ ಕನ್ಸಲ್ಟೆಂಟ್ ಫಿಸಿಷಿಯನ್. ಡಾಕ್ಟರ್ ಸಂಜೀವ್ ರಾವ್, ವೆಲ್ಕಮ್ ಟು ದ ಶೋ. ಇದಾರಲ್ವಾ ಡಾಕ್ಟರ್ ಸಂಜೀವ್ ರಾವ್?
ಅನ್ಮ್ಯೂಟ್ ಮಾಡ್ಕೊಳ್ಳಿ ಸರ್.
Thank you very much.
Doctor, I'll come back to you later for the questions for you. Next barodu Dr. K. Vijay Kumar anta. He is MBBS MD, John Hopkins University School of Medicine in the PG program diabetology ಅಲ್ಲಿ ಮಾಡಿದ್ದಾರೆ. Cardiff University UK ಇಂದ PG diploma in diabetes ಮಾಡ್ಕೊಂಡಿದ್ದಾರೆ. He is presently a member of Karnataka chapter KRSSDI, Research Society for the Study of Diabetes in India, RSSDI, Bangalore Diabetes Association and Indian Medical Association. Sir, ನೀವು ಮನೋಹರ್ ತರ ಸ್ವಲ್ಪ ಮ್ಯಾರಥಾನ್ ಮಾಡ್ದಂಗಿದೆ ಇದ್ರೊಳಗೆಲ್ಲ. He's also secretary for Disha Diabetes Symposia, secretary at GT Foundations. ಈ GT Foundations Dr. Manohar ಹೇಳ್ತಾ ಇದ್ರು, but here I got the details. It's an NGO which has adopted already 2 villages for healthcare benefits. Sir, this is awesome. And also Dr. Vijay Kumar is a physician and diabetologist as of now. So Dr. Vijay Kumar, ನಿಮಗೆ ಸ್ವಾಗತ ಈ ಸ್ಪೆಷಲ್ ವಿಶೇಷ ಮಧುಮೇಹ ಪಂಚಾಯತಿಗೆ.
Thank you, Mrs. Pratibha. I'll try to tell a couple of words. ಒಂದೆರಡು ಮಾತು ಹೇಳ್ತೀನಿ. ದಿಶಾ ಅಂದ್ರೆ ಆಗ್ಲೇ ನೀವು ಕೇಳಿದ್ರಿ ದಿಶಾ ಏನು ಅಂತ. ಬೇಸಿಕಲಿ ಸ್ವಲ್ಪ ಇಲಾಬ್ರೇಟ್ ಆಗಿ ಹೇಳ್ತೀನಿ ಇವಾಗ. ದಿಶಾ ಅಂದ್ರೆ ಡೈರೆಕ್ಷನ್, ಅಷ್ಟೇ ಮನೋಹರ್ ಹೇಳಿದ್ದು. ಏನು ಡೈರೆಕ್ಷನ್ ಅಂತಂದ್ರೆ, ಬಹಳ ಜನ ಇದು ಮುಖ್ಯವಾಗಿ ಡಯಾಬಿಟೀಸ್ ಅನ್ನೋ ವಿಷಯ ತಗೊಂಡು ಇದರಲ್ಲಿ ಬಹಳ ಜನ ಫಿಸಿಷಿಯನ್ಸ್ಗೆ ತುಂಬಾ ನಾಲೆಜ್, ಹೊಸ ನಾಲೆಜ್ ಅನ್ನೋದು ಏನಿದೆಯೋ ಅದು ಬೇರೆ ಬೇರೆ ಗೈಡ್ಲೈನ್ಸ್ ಇಂದ ತಗೊಂಡ್ ಬಂದು ಬೇರೆ ಬೇರೆ ಸ್ಪೆಷಾಲಿಟಿ ಡಾಕ್ಟರ್ಸ್ ನ ಎಲ್ಲ ಒಟ್ಟುಗೂಡಿಸಿ we gather together and make a conference and distribute the newest and the latest knowledge to guide, to show a direction in managing diabetes in a latest method. So this is one of the concept. Plus when coming to the public aspect, public ನಲ್ಲಿ ಪ್ರಾಪರ್ ಆಗಿ ಇಂಥ ಒಂದು ಪ್ರೋಗ್ರಾಮ್ಗಳು ಮಾಡಿ ಗಿವ್ ಆಲ್ ದಿ ಇನ್ಫಾರ್ಮೇಶನ್ ಅಬೌಟ್ ಡಯಾಬಿಟೀಸ್, ಹೊಸದೇನಿದೆ ಅಂತ ಮತ್ತೆ ಪಬ್ಲಿಕ್ ಅಲ್ಲಿ ಗೈಡ್ ಮಾಡಿ ಅವರಿಗೆ ಯಾವ ತರ ಡಯಾಬಿಟೀಸ್ ಅನ್ನ ನಿಯಂತ್ರಣ ಮಾಡ್ಕೋಬೇಕು ಅನ್ನೋ ಒಂದು ದಾರಿ ತೋರಿಸೋ ಒಂದು ಪ್ರೋಗ್ರಾಮ್. ಸೊ ಎಲ್ಲಾ ಕಡೆಯಿಂದನೂ ಡಯಾಬಿಟೀಸ್ ವಿಷಯದಲ್ಲಿ ಹೇಗಿರ್ಬೇಕು, ಏನ್ ಮಾಡ್ಬೇಕು ಅನ್ನೋ ಒಂದು ದಾರಿ ತೋರಿಸೋ ಅಂತ ಒಂದು ಕಾನ್ಸೆಪ್ಟ್ ಇಟ್ಕೊಳ್ಳೋದ್ರಿಂದ ಇದು ದಿಶಾ ಡೈರೆಕ್ಷನ್.
ಥ್ಯಾಂಕ್ ಯು ಡಾಕ್ಟರ್ ವಿಜಯ್ ಕುಮಾರ್, ನೀಟಾಗಿ ಹೇಳಿದ್ರಿ. ನೀವ್ ಹೇಳಿದ ಕೇಳಿದ್ರೆ ಗೊತ್ತಾಯ್ತು, ಬರೀ ಇಲ್ಲಿ ಡಾಕ್ಟರ್ಸ್ ನಾವು ಈ ಜನರಲ್ ಟೆಕ್ನಾಲಜಿಯಿಂದ ಅಪ್ಡೇಟ್ ಅಂತ ಮಾಡ್ತಾ ಇಲ್ಲ. ಇವು ಜನರಲ್ ಆಗಿ ಜನಸಾಮಾನ್ಯರಿಗೂ ಏನೇನೋ ವಿಷಯಗಳು ತಲೆಯಲ್ಲಿ ಇರುತ್ತೆ, ಬಟ್ ಅದನ್ನ ನೀವು ಕೂಡ್ಸ್ಕೊಂಡ್ಬಿಟ್ಟು ಅವ್ರಿಗೊಂದ್ಸಲ ಎಜುಕೇಟ್ ಮಾಡ್ತಿರಲ್ಲ. ದಟ್ ಇಸ್ ದ ರಿಯಲ್ ಬಿಗ್ ವೆಂಚರ್. ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್. ಮತ್ತೆ ನಿಮ್ಗೆ ಬೇರೆ ಪ್ರಶ್ನೆಗಳಿದೆ, ಬರ್ತೀನಿ ಮುಂದೆ. ನೆಕ್ಸ್ಟ್ ನಾನು ಪರಿಚಯ ಮಾಡ್ಕೊಡ್ತಾ ಇರೋದು ಡಾಕ್ಟರ್ ಪಲ್ಲವಿ ಬಿ ಅಂತ. She is a MD gold medalist, also DNB, MN AMS, ಆಸ್ಟಿಕಾನ್ ಅಂತ ಹೇಳಿ 2013 ಅಲ್ಲಿ ಅವರು ಶೀಸ್ ಅವಾರ್ಡ್ ವಿನ್ನರ್ ಫಾರ್ ಬೀಂಗ್ ಔಟ್ಸ್ಟ್ಯಾಂಡಿಂಗ್ ಸ್ಟೂಡೆಂಟ್ ಇನ್ MD ಡರ್ಮಟಾಲಜಿ ಫ್ರಮ್ JSS ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ ಮೈಸೂರು. She's presented papers in national and international conferences, also published papers in peer-reviewed journals. Dr. Pallavi, ಈ ಸ್ಪೆಷಲ್ ಮಧುಮೇಹ ಪಂಚಾಯಿತಿಗೆ ನಿಮಗೆ ಸ್ವಾಗತ.
ನಮಸ್ಕಾರ, ಥ್ಯಾಂಕ್ ಯು.
ನೆಕ್ಸ್ಟ್ ನಮ್ಮ ಪ್ಯಾನಲ್ ಅಲ್ಲಿ ಇರೋರು ಡಾಕ್ಟರ್ ಅಮಲಾ ಸೆಲ್ವಂ ಅಂತ. ಹೀಸ್ MBBS MD, ಕನ್ಸಲ್ಟೆಂಟ್ ಫಿಸಿಷಿಯನ್. ಇವತ್ತು ಅವ್ರನ್ನ ಸಾಲಿಡ್ ಆಗಿ ನಮ್ಮ ಫೀಲ್ಡ್ ಅಲ್ಲಿ ವಾಟ್ ಇಸ್ ಮೋರ್ ಇಂಪಾರ್ಟೆಂಟ್ ಡಯಟ್ಸ್ ಎಲ್ಲ ಇರುತ್ತೆ, ಅದರಲ್ಲಿ ಕ್ವಿಜ್ ಮಾಡ್ತೀವಿ ಮುಂದೆ. ಡಾಕ್ಟರ್ ಅಮಲಾ ಸೆಲ್ವಂ, ನಿಮ್ಗೆ ಸ್ವಾಗತ ಈ ಮಧುಮೇಹ ಪಂಚಾಯಿತಿಗೆ.
ಥ್ಯಾಂಕ್ ಯು.
ಮುಂದೆ ಬರ್ತಾ ಇರೋರು ಡಾಕ್ಟರ್ ಶ್ರುತಿ ದಾಸ್ ಶೆಟ್ಟಿ ಅಂತ. ಶಿ ಇಸ್ ಕನ್ಸಲ್ಟೆಂಟ್ ಆಫ್ಥಾಲ್ಮಾಲಜಿ, MS ಆಫ್ಥಾಲ್ಮಾಲಜಿ ಮಾಡ್ಕೊಂಡ್ಬಿಟ್ಟು ಇವಾಗ ಶಿ ಇಸ್ ಡೂಯಿಂಗ್ ಕನ್ಸಲ್ಟೇಷನ್. ಇಟ್ಸ್ ಆಲ್ಸೋ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ರೋಲ್ ವೆನ್ ಇಟ್ ಕಮ್ಸ್ ಟು ಡಯಾಬಿಟಿಸ್. ಸೊ ಡಾಕ್ಟರ್, ವೆಲ್ಕಮ್ ಟು ಮಧುಮೇಹ ಪಂಚಾಯಿತಿ. ಡಾಕ್ಟರ್ ಶ್ರುತಿ ದಾಸ್ ಶೆಟ್ಟಿ. ಕೊನೆಯದಾಗಿ ನಮ್ಗೆ ಇರೋರು ಈ ಪಂಚಾಯಿತಿಯಲ್ಲಿ ಡಾಕ್ಟರ್ ಶ್ರೀಧರ್ ಕೆ ಅಂತ. ಅವ್ರದ್ದೊಂದು ಕಿರು ಪರಿಚಯ ಮಾಡ್ಕೊಡ್ತೀನಿ. ಹೀಸ್ MBBS from KMC Mangalore, certificate in diabetes management from Medversity Apollo, CCE BDM in 2016, 2017 CCMTD. ಅದರಲ್ಲದೆ ಅವರು ಈಸ್ ಅ ಲೈಫ್ ಮೆಂಬರ್ ಆಫ್ RSSDI, KRSSDI, IMA and FP. ಇವ್ರಿಗೂ ಹಲವಾರು ಪ್ರಶಸ್ತಿಗಳು ಬಂದಿದೆ. ಅದ್ರಲ್ಲಿ ಕೆಲವು ಮಾತ್ರ ಲಿಮಿಟ್ ಆಗಿ ಹೇಳ್ತೀನಿ. ಇಸ್ 3D ಡಯಾಬಿಟಿಸ್ ಅವೇರ್ನೆಸ್ ಅವಾರ್ಡ್ ಬಂದಿದೆ KRSSDI ಇಂದ. ಮ್ಯಾರಥಾನ್ ಫುಲ್ ಸ್ಟಾರ್ಟ್ಅಪ್ ಮ್ಯಾರಥಾನ್ ಅಲ್ಲಿ ಸಕ್ಸಸ್ಫುಲ್ ಕಂಪ್ಲೀಷನ್ ಅವಾರ್ಡ್ ಬಂದಿದೆ. ಆರ್ಗನೈಸಿಂಗ್ ಕಮಿಟಿ ಮೆಂಬರ್ ಆಫ್ KRSSDI 2017 ಅಲ್ಲಿ. ಡಾಕ್ಟರ್ ಶ್ರೀಧರ್ ಕೆ ಅವರೇ, ನಿಮ್ಗೆ ಇವತ್ತು ಸ್ಪೆಷಲ್ ಮಧುಮೇಹ ಪಂಚಾಯಿತಿಗೆ ಸ್ವಾಗತ. ಇದಲ್ಲದೆ ವಿ ಹ್ಯಾವ್ ಒನ್ ಸ್ಪೆಷಲ್ ಇನ್ವೈಟಿ. ಜನಸಾಮಾನ್ಯರಿಂದ ಒಬ್ಬರನ್ನ ಇನ್ವೈಟ್ ಮಾಡ್ಕೊಂಡಿದ್ವಿ, ಸುರೇಶ್ ಕುಮಾರ್ ಅಂತ. ಸೊ ಎಲ್ರಿಗೂ ಪ್ರಶ್ನೆ ಕೇಳೋಕ್ಕಿಂತ ಮುಂಚೆ ನಾನು ಫಸ್ಟ್ ನನ್ನ ಕ್ವೆಶನ್ ಹಾಕುದೇ ಸುರೇಶ್ ಕುಮಾರ್ ಅವ್ರಿಗೆ. ನಮಸ್ಕಾರ ಸುರೇಶ್ ಕುಮಾರ್ ಅವರೇ.
ನಮಸ್ಕಾರ ಪ್ರತಿಭಾ ಅವರೇ, ಬಹಳ ಸಂತೋಷ ಆಯ್ತು ನೀವು ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಕರೆದಿರೋದಕ್ಕೆ.
ಸುರೇಶ್ ಕುಮಾರ್ ಅವರೇ, ಒಂದು ಜನರಲ್ ಆಗಿ ಹೇಳ್ತೀವಿ, ಜನಸಾಮಾನ್ಯರಲ್ಲಿ ಡಯಾಬಿಟೀಸ್ ಅಥವಾ ಮಧುಮೇಹ ಅಂದ ತಕ್ಷಣ ಕೆಲವು ವಿಚಾರಗಳು ತಲೆಯಲ್ಲಿ ಬರತ್ತೆ. ಆ ವಿಚಾರಗಳು ಏನು ಅಂತ ಈ ಎಲ್ಲ ಡಾಕ್ಟರ್ಸ್ ಮುಂದ್ಗಡೆ, ಯಾಕಂದ್ರೆ ಅವರು ಡಾಕ್ಟರ್ಸ್ ಎಲ್ಲ ಪರಿಚಯ ಇರತ್ತೆ, ಎಷ್ಟು ನೂರಾರು ಕ್ವಶನ್ ಗಳ ತಲೆ ತಿಂದು ಹಾಕ್ತಿರ್ತಾರೆ. ಆದ್ರೆ ನಿಮ್ಮ ದೃಷ್ಟಿಕೋನದಿಂದ, ಯೋರ್ ಪರ್ಸ್ಪೆಕ್ಟಿವ್ ಪಾಯಿಂಟ್ ಇಂದ ನಿಮ್ಮ ಡಯಾಬಿಟಿಸ್ ಬಗ್ಗೆ ಏನಿದೆ ನಿಮ್ ತಲೆಯಲ್ಲಿ?
ಈ ಜನಸಾಮಾನ್ಯರಲ್ಲಿ ಈ ಮಧುಮೇಹ ಅಥವಾ ಇಷ್ಟೊಂದು ಒಂದು ಗಂಭೀರವಾಗಿ ಯಾರು ಯೋಚನೆನೂ ಮಾಡಲ್ಲ ಶುಗರ್ ಆರೋಗ್ಯ ಬಗ್ಗೆ. ಆದ್ರೆ ಇತ್ತೀಚೆಗೆ ಏನಾಗಿದೆ ಅಂದ್ರೆ ಜನಗಳು ಎಲ್ಲಾರು ಅವ್ರಿಗೆ ಶುಗರ್ ಬಂದ್ರೆ ಯಾರೋ ಸಾಹುಕಾರರ ಕಾಯಿಲೆ ಅಂತ, ಇದು ಯಾರೋ ಸಾಹುಕಾರರ ಕಾಯಿಲೆ, ಇದು ದುಡ್ಡಿರೋರಿಗೆ ಚೆನ್ನಾಗಿ ತಿಂದು ಬರೋ ಕಾಯಿಲೆ ಅಂತ ಜನಗಳಲ್ಲಿ ಒಂದು ಅಭಿಪ್ರಾಯ. ಆದ್ರೆ ಈ ಕಾಯಿಲೆ ಬಂದಿರೋದು ಬಡವ್ರಿಗೆ ಬರಲ್ಲ, ಕಷ್ಟಪಟ್ಟು ದುಡಿಯೋರ್ಗ್ ಬರಲ್ಲ ಅನ್ನೋ ಒಂದು ಭಾವನೆಗಳು ಜನಗಳಲ್ಲಿ ಇರುತ್ತೆ. ನಮ್ಮ ಊರುಗಳಲ್ಲಾಗ್ಲಿ ಹಳ್ಳಿಗಳಲ್ಲಾಗ್ಲಿ ಅವರು ಟೆಸ್ಟ್ ಮಾಡಿಸ್ಕೊಳ್ಳೋ ಒಂದು ಪರೀಕ್ಷೆ ಮಾಡಿಸ್ಕೊಂಡು ನಮಗೆ ಶುಗರ್ ಇದೆಯೋ BP ಇದೆಯೋ ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಅವ್ರಿಗೆ ಒಂದು ಕಾಳಜಿನೂ ಇರೋದಿಲ್ಲ. ಸೊ ಆ ಮಟ್ಟದಲ್ಲಿ ಇರೋದ್ರಿಂದ ಜನಗಳಲ್ಲಿ ಅವರು ಅಷ್ಟೊಂದು ಗಂಭೀರವಾಗಿ ತಕೊಂಡು ಇಂಥದ್ದೊಂದು ಕಾಯಿಲೆಗಳಿಗೆ ಎಲ್ಲರಿಗೂ ಬರೋ ಸಾಧ್ಯತೆ ಇದೆ, ಅದ್ರ ಬಗ್ಗೆ ನಾವು ಪರೀಕ್ಷೆ ಮಾಡಿಸ್ಕೋಬೇಕು, ಅದಕ್ಕೆ ಸೂಕ್ತವಾದ ಚಿಕಿತ್ಸೆ ಪಡ್ಕೋಬೇಕು ಅನ್ನೋ ಒಂದು ಗಾಂಭೀರ್ಯತೆ ಇರಲ್ಲ. ಮತ್ತೆ ಅವ್ರು ಎಲ್ಲೋ ಅದು ಯಾವುದೋ ಒಂದು ಆಗಿನ ಕಾಲದಿಂದ ಒಂದು ತಲೆಯಲ್ಲಿ ಅವ್ರಿಗೆ ಏನ್ ಬಂದ್ಬಿಟ್ಟಿದೆ ಅಂದ್ರೆ, ಶುಗರ್ BP ಎಲ್ಲ ಸಾಹುಕಾರರಿಗೆ ಬರೋದು, ದುಡ್ಡಿರೋರಿಗೆ ಚೆನ್ನಾಗಿ ತಿನ್ನಿರೋರಿಗೆ, ನಾವು ಕಷ್ಟಪಟ್ಟು ದುಡಿತೀವಿ, ಹಳ್ಳಿ ಊರುಗಳಲ್ಲಿ ಇವೆಲ್ಲ ಬರಲ್ಲ ಅನ್ನೋ ಒಂದು ತಲೆಯಲ್ಲಿ ಇರುತ್ತೆ ಅವ್ರಿಗೆ. ಸೊ ಈ ಒಂದ್ ಇದ್ರಿಂದ ಹಂಗ್ ನೋಡಕ್ ಹೋದ್ರೆ ನಾವು ಬಹಳ ಮಟ್ಟದಲ್ಲಿ, ಬಹಳ ದೊಡ್ಡ ಮಟ್ಟದಲ್ಲಿ ಈ ಜನಗಳಿಗೆ ಅವೇರ್ನೆಸ್ ತರಲಿಕ್ಕೆ ಪ್ರಯತ್ನ ಪಡ್ಬೇಕಾಗತ್ತೆ. ಆಮೇಲೆ ಅವ್ರಿಗೆ ಎಷ್ಟೋ ಜನಗಳಿಗೆ ಅನೇಕ ಬಾರಿ ನಾವು ನಮ್ಮ ಮನೋಹರ್ ಅವರ ಮುಖಾಂತರ ಈ ಹೆಲ್ತ್ ಕ್ಯಾಂಪ್ಗಳು ಮಾಡಿದಾಗ, ಆರೋಗ್ಯ ಶಿಬಿರಗಳನ್ನ ಮಾಡಿದಾಗ ಎಷ್ಟೋ ಜನಗಳಿಗೆ 500 ಅಷ್ಟು ಶುಗರ್ ಇತ್ತು. ಆದ್ರೆ ಅವ್ರಿಗೆ ಅರೆ ಫಸ್ಟ್ ಟೈಮ್ ನಾನು ಇದೇ ಟೆಸ್ಟ್ ಮಾಡಿಸ್ಕೊಂಡಿರೋದು, ಈ ತರ ಬಂದ್ಬಿಟ್ಟಿದ್ಯಾ ನನಗೆ, ಅಯ್ಯಯ್ಯೋ ನಾನೇನ್ ಮಾಡಿದ್ದೆ, ನನಗೇನಾಯ್ತು ಅಂತ ಒಂಥರ ಅವರು ಗಾಬರಿ ಆಗ್ತಾರೆ ಹೊರತು ಅದಕ್ಕೆ ಏನ್ ಮಾಡ್ಬೇಕು ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಅವ್ರಿಗೆ ಯೋಚನೆ ಮಾಡೋಂತ ಒಂದು ಇದಿರುತ್ತೆ.
ನೀವು ಹೇಳೋ ಪ್ರಕಾರ ಈಗ ನಾವು ಅವೇರ್ನೆಸ್ ಕ್ರಿಯೇಟ್ ಮಾಡೋದು ಬಹಳ ಇಂಪಾರ್ಟೆಂಟ್ ಆಗಿದೆ ಅಂತ ಹೇಳ್ತಾ ಇದ್ದೀರಾ. ಸುರೇಶ್ ಕುಮಾರ್ ಅವರೇ, ನೀವು ಇವ್ರ ಪ್ಯಾನಲ್ ಡಿಸ್ಕಷನ್ಸ್ ಆಗ್ಲಿ, ಇವ್ರ ಪ್ರಶ್ನೆಗಳನ್ನ ಉತ್ತರ ಮಾಡ್ಲಿ, ಕೊನೆಗೆ ಮತ್ತೆ ಬರ್ತೀನಿ ನಿಮ್ಗೆ ಇವ್ರೆಲ್ಲ ಮಾತಾಡೋದ್ರ ಮೇಲೆ ಏನ್ ಎಫೆಕ್ಟ್ ಆಗಿದೆ ನಿಮ್ಗೆ ಅಂತ ಮತ್ತೊಮ್ಮೆ ಕೇಳ್ತೀನಿ. ಇವಾಗ ಪ್ರಾರಂಭ ಮಾಡೋಣ. ನಾವು ಡಾಕ್ಟರ್ಸ್ ಗಳನ್ನ ಪರಿಚಯ ಮಾಡ್ಕೊಂಡು ಅವ್ರಿಗೆ ಕ್ವಶನ್ಸ್ ಕೇಳೋಣ. ನಾನು ಫಸ್ಟ್ ಡಾಕ್ಟರ್ ಸಂಜೀವ್ ಕುಮಾರ್ ಅವ್ರಿಗೆ ಪ್ರಶ್ನೆ ಕೇಳ್ತಾ ಇದ್ದೀನಿ. ಸಂಜೀವ್ ಕುಮಾರ್ ಅವರೇ, ಡಯಾಬಿಟಿಸ್ ಅಥವಾ ಈ ಮಧುಮೇಹ ಅಂದ ತಕ್ಷಣ ಎಲ್ರಿಗೂ ಹೆದರಿಕೆ ಬರೋದು ಏನಂತಂದ್ರೆ ಇದರಿಂದ ಬರೋ ಕಾಂಪ್ಲಿಕೇಶನ್ಸ್ ಅಂತ. ಎಲ್ಲೆಲ್ಲಿ ಕಾಂಪ್ಲಿಕೇಶನ್ಸ್ ಬರುತ್ತೆ, ಯಾವ್ಯಾವ ಬರುತ್ತೆ ಅಂತ ಜನರಲ್ ಗೊತ್ತಿಲ್ಲ. ಏನೋ ಕಷ್ಟ ಆದಾಗ ನಾವು ಡಾಕ್ಟರ್ಸ್ ಹತ್ರ ಹೋದಾಗ ಇಲ್ಲ ಇದರಿಂದ ಬರುತ್ತೆ, ಟೆಸ್ಟ್ ಮಾಡ್ಸಿ ಅಂತಾರೆ. ಸೊ ನಿಮ್ ದೃಷ್ಟಿಕೋನದಿಂದ ಈ ಕಾಂಪ್ಲಿಕೇಶನ್ಸ್ ಯಾವ್ದ್ಯಾವ್ದು, ಯಾವ ತರ ಬರ್ಬೋದು, ನೀವೇನ್ ಕೆಲವು ಮಾತುಗಳು ನಮ್ಗೆ ಕೇಳಿದ್ರೆ ನಮ್ಗೆ ಎಜುಕೇಟ್ ಆಗುತ್ತೆ. ಡಾಕ್ಟರ್ ಸಂಜೀವ್ ಕುಮಾರ್ ಅವರು.
Good evening. I'm Dr. Sanjeev Rao.
Yeah.
There was a question if this is going to be in English or in Kannada. So, for the sake of that gentleman, I shall be speaking in English. All right?
Sure, no issues.
Okay.
Yeah.
You must pardon my voice. I've got a very bad sore throat, so I'm a little hoarse. Now, please remember, diabetes is a disease which will affect every part of your body. It can affect your brain, it can affect your eye, you can affect your lung, it can affect your heart, affect your kidneys, you can affect your intestine, nerves, foot, any place. Basically, because this is a disorder of a body process wherein sugar is a part of it. There are other components also. And the net effect is there is a disorder of the entire body process of eating, digestion, everything. Thereby, the entire body can get affected. There is nothing which is spared.
Would you like to highlight on specific systems?
Just recapitulate from top to bottom. Brain, eye, lung, heart, stomach, liver, kidney, intestine, your genitalia, your blood circulation to the upper and lower limbs, your diabetic foot, infection chances, everything. So, if you start from the brain, you can have a paralytic attack, you can have bleeding, you can have premature dementia. If you talk about the eye, the commonest cause of blindness in the elderly is diabetes. If you come to the heart, people with diabetes have higher chances of developing heart failure. They have higher chances of developing heart attack. There are higher chances of having all sorts of irregular heartbeats. These people are also very prone to developing infections, as just mentioned. And in the lungs, there's the commonest cause of tuberculosis is diabetes. Similarly, there is some problem with lungs, which has been recently recognized in people with diabetes. In the stomach, because the nerves of the stomach get affected, the stomach does not digest properly, and food stays there for a very, very long time. So you don't digest well. Because of this, the liver also can get affected, and we have what is known as a fatty liver. Once the intestine gets affected, you can have again problems with the intestine, and the foods get stuck there and causes a lot of abdominal distension and problems, and you will not be able to pass stools. Similarly, the kidney can get affected by infection, or the urinary bladder gets affected and it cannot empty the urine out of the body. Similarly, the people with diabetes also can develop phimosis. Phimosis is the narrowing of the foreskin of the penis. And so for that, the only treatment would be removing that by circumcision. Then you can have sexual dysfunction. You will not get erection, or you get premature ejaculation. Further, if you go down further to the legs, you can have diabetic feet, where the joints get affected. and you have chances of getting more infection, and you have loss of sensation in the hands and feet. And once the sensations get affected, the joints cannot be held properly, and they get all funny shapes and a lot of problems thereafter. But gratifyingly, this doesn't come the moment you develop diabetes. This takes many years to unfold. And if you keep your blood sugars, your cholesterol, and all the other things well in check, you can lead a very, very normal life. Any other questions?
You are muted, Pratibha. I think please unmute all the panelists.
Yeah. Okay, sorry. Doctor, you kept mentioning that it takes nearly quite a number of years for it to unfold, and only then we realize we have diabetes. So how do we tell common people?
Diabetes complications, not diabetes.
Okay, but how do we advise general public to regularly keep checking? Because general public has a notion that if we go, we have to spend money on tests and everything. I'm talking about general public. So how do we advise people who are more prone to these such problems and complications? Who should be testing it out?
See, if you go and meet a good doctor, he will first do your checks, general physical examination. Generally, when you do a physical examination, you will pick up these things, your blood circulation problems, your nerves, weakness, anything else. When he discusses, when he talks to you, he will tell you. Then he will tell you, he or she rather, will tell you what exactly you are to look for. And then he gets those tests done. Once these tests are done, he looks at those reports and says, okay, this is what is this, this is what has to be done. For every problem, there's a solution. So, ella problem ge parihara. So, it's very, very simple actually. All you have to have is an organized approach, and you should meet one particular doctor of your choice and stick with him or her, because there will be some continuity. But if you drift like a ship from port to port, every time you'll have a problem. You won't know who's, one fellow will do one thing, the next will do something else, and the only person who suffers will be the patient.
Absolutely. Dr. Manohar, there's a question. Can I pose it to Mr. Sanjeev?
Yes.
Yeah, because there was one question on diabetes.
Or we could take
okay.
it
There's
later.
one Mr. Win.
Yeah.
Later? Yeah, okay.
Yeah,
I'll do that. Okay. Next question to Dr. Pallavi. You're a dermatologist, Dr. Pallavi. As just now Dr. Sanjeev Rao said, diabetes affects each and every part of the body. So now skin is the one major costume that we actually wear, and that is the most primary thing we need. So according to you, how exactly does diabetes affect the skin or any other related complications that come out of it?
Okay, first of all, skin is the largest organ of the body. So, sir already elaborated on all the organs. So, I think he left the skin part to me. So, skin is a mirror which reflects internal diseases. So, ಕನ್ನಡದಲ್ಲಿ ಹೇಳ್ಬೇಕಾದ್ರೆ ಚರ್ಮ ಕನ್ನಡಿ ಅಂತೆ. ನಮ್ಮ ದೇಹದಲ್ಲಿ ಯಾವುದೇ ಒಂದು ತೊಂದರೆ ಆದ್ರೇನು ಚರ್ಮದಲ್ಲಿ ಕಾಣಿಸುತ್ತದೆ. So, about 30 to 60% of diabetics would develop a skin disease during the course of diabetes. So, firstly, the most common skin manifestation which we see is infections, which includes bacterial, fungal, and under the infections, the nails also can be affected. So mainly bacterial infections could be boils, which we call it as furuncle, cellulitis, which may lead to gangrene, which is a life-threatening complication. Fungal infections, in common terms, we call it is hulkadi, which is itching over the groin folds, armpits, thighs, and thighs. When it involves the groin folds, we call it as jock itch. And tinea pedis, foot infections. So most of the diabetics have rash in between the toes. which they ignore. So this acts as an entry for the organisms, which leads to cellulitis and gangrene. The next common skin change which they see is generalized dryness, onacharma. The third one is turike, generalized itching, more commonly on the legs. Kalina Mumbagadalli, they have this itching, which leads to various rashes. The next common manifestation which we see is diabetic dermopathy, where we see dark patches on the legs, which may ulcerate and leading to various complications. The most after these complications, the patients who present with these skin tags, andre kattali gantugalu, kappu gantugalu in the neck, axilla, and thighs. So these are associated with diabetes. With this background, there are some disorders which are seen in diabetes, but not necessarily that all of them would be diabetic. They're just associated with diabetes. When they're present, we have to rule out diabetes. So those are vitiligo, or in common language, we call it as tonnu, white patches on the body, psoriasis, lichen planus, acanthosis nigricans, where there is pigmentation over the neck, armpits, and thighs. So children who have insulin resistance, so they do present with acanthosis nigricans. They present with pigmentation around the neck. So we do have to tell them that they are more prone to developing diabetes mellitus. So with this, these are the manifestations which we see in diabetes. So early recognition of these skin changes can avoid certain complications.
Oh, Dr. Sanjay Rao said whole body, and then you came into skin, and even the skin, you have gone from head to toe, every part, we have a different type of problem coming. Oh my God, it's like a whole. Dr. Manoj, please, I'll be pulling your leg today because it's like another marathon run throughout. Because so many issues coming up, and ಎಲ್ಲೋ ಒಂದ್ ಕಡೆ ಡಯಾಬಿಟಿಸ್ ಕಾರಣ ಅಂತೀರಾ. ನೋ ವಂಡರ್ ನಾವ್ ಯಾವ ಡಾಕ್ಟರ್ಗೆ ಏನ್ ಪ್ರಾಬ್ಲಮ್ ಹೋದ್ರು ನಿಮ್ಗೆ ಡಯಾಬಿಟಿಸ್ ಇದೆಯಾ ಅಂತ ಫಸ್ಟ್ ಕ್ವಶನ್ ಕೇಳ್ತಾರೆ. ಸೊ ಈಗ ನನಗೆ ಇವಾಗ ಜನಸಾಮಾನ್ಯ ಪರವಾಗಿ ಹೇಳ್ತೀರಿ, ಇವಾಗ ಅರ್ಥ ಆಗ್ತದೆ ಯಾಕೆ ಎಲ್ಲರೂ ಡಾಕ್ಟರ್ ಫಸ್ಟ್ ಡಯಾಬಿಟಿಸ್ ಇದೆಯಾ ಅಂತ ಕೇಳ್ತಾರೆ ಅಂತ ಹೇಳಿ. ಸೊ ಈ
one more thing before we proceed is people should not think that we are just educating, we're not scaring. Everyone will not have all the complications. ಕೆಲವರಿಗೆ ನಾವು ಚೆನ್ನಾಗಿ ನಮ್ಮನ್ನ ನೋಡ್ಕೊಳ್ದೆ ಹೋದ್ರೆ ಇದೆಲ್ಲ ಆಗ್ಬಹುದು ಅಂತ. ಸೊ ಇಟ್ ಇಸ್ ಜಸ್ಟ್ an educational thing. Go ahead.
ಇಟ್ಸ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಯಾಕಂದ್ರೆ ಗೊತ್ತಾಗ್ಬೇಕಲ್ವಾ, ಆಯ್ತಂದ್ರೆ ಈ ಪ್ರಾಬ್ಲಮ್ ಇದ್ರೆ ಈ ಕಾಂಪ್ಲಿಕೇಶನ್ಸ್ ಬರುತ್ತೆ ಅಂತ ಹೇಳಿ. ಈಗ ಜನರಲ್ ಏನ್ ಮಾಡ್ತಾರೆ ಜನ, ಒಂದ್ ಸ್ವಲ್ಪ ಸ್ಕ್ರಾಚ್ ತುರ್ಕೆ ಬಂದ್ರು ಹೇಳ್ತಿರಲ್ಲ, ಇಂಟರ್ನೆಟ್ ನೆಟ್ಟಿಗೆ ಹೋಗಿ ದೇ ವಿಲ್ ಫೈಂಡ್ ಔಟ್ 100 ಡಿಫ್ರೆಂಟ್ ನನ್ಗೆ ಆಗ್ಬಿಟ್ಟಿದೆ ಅಂತ ಹೆದರ್ತಾರೆ. ಸೊ ಬೆಟರ್ ಅವಾಯ್ಡ್. ಈ ತರ ಪ್ರಾಪರ್ ಎಜುಕೇಶನ್ ಆದ್ರೆ ಅಟ್ಲೀಸ್ಟ್ ಆಪ್ಷನ್ಸ್ ಇರುತ್ತೆ. ಸೊ ವಿಲ್ ಗೋ ಅಂತ. ಥ್ಯಾಂಕ್ಸ್ ಡಾಕ್ಟರ್ ಪಲ್ಲವಿ ನಮ್ಗೆ ಸ್ಕಿನ್ ಬಗ್ಗೆ ಕಾಂಪ್ಲಿಕೇಶನ್ಸ್ ಬಗ್ಗೆ ಹೇಳಿದ್ದಕ್ಕೆ. ಸೊ ಲೇಟರ್ ವಿಲ್ ಕಮ್ ಬ್ಯಾಕ್ with any final questions if you have. ಡಾಕ್ಟರ್ ಶ್ರುತಿ ಅವರೇ, ನಿಮ್ಗೆ ನೆಕ್ಸ್ಟ್ ನನ್ ಕಡೆಯಿಂದ ಪ್ರಶ್ನೆ. ಜನರಲ್ ನಾನ್ ಕೇಳಿದ ಬಗ್ಗೆ ಕೆಲವ್ರು ಕಣ್ ಮಬ್ಬಾಗಕ್ ಶುರು ಆದ ತಕ್ಷಣ ಫಸ್ಟ್ ಹೇಳೋದು ನಿಂಗೆ ಡಯಾಬಿಟಿಸ್ ಇದೆಯಾ, ಕಣ್ಣು ಕಾಣಿಸ್ತಿಲ್ಲ ಅಂತ ಹೇಳ್ತಾರೆ. ಬಟ್ ಇದು ಒಂಥರ ನಮ್ಗೆ ಪೂರ್ತಿ ಅರ್ಥ ಆಗ್ಲಾರ್ದ ಸಿಚುವೇಶನ್. ಸೊ ಈ ಡಯಾಬಿಟಿಸ್ ಅಥವಾ ಮಧುಮೇಹ ಇದ್ರೆ ಕಣ್ಣು ಯಾವ ತರ ಎಕ್ಸಾಕ್ಟ್ಲಿ ಎಫೆಕ್ಟ್ ಆಗತ್ತೆ, ಅವ್ರು ವಾಟ್ ವಿ ಶುಡ್ ಡೂ ಟು ಅವಾಯ್ಡ್ ಇಟ್?
ಓಕೆ ಮೇಡಮ್, ಒಂದು ಕ್ಲಿಯರ್ ಮಾಡಕ್ ಇಷ್ಟಪಡ್ತೀನಿ. ಯಾವಾಗ ನಮಗ್ ಡಯಾಬಿಟಿಸ್ ಡಯಾಗ್ನೋಸ್ ಆಗುತ್ತೆ, ನಾವು ದೃಷ್ಟಿ ಕಡಿಮೆ ಆಗೋ ತನಕ ವೇಟ್ ಮಾಡಬಾರ್ದು. ಇವತ್ತು ನಮ್ಮೆಲ್ಲಾ ಕಲೀಗ್ಸ್ಗೂ ಹೇಳ್ತೀವಿ, ಫಿಸಿಷಿಯನ್ ಎನಿ ಫಸ್ಟ್ ಟೈಮ್ ಪೇಷಂಟ್ ಗೆಟ್ ಡಯಾಗ್ನೋಸ್ ವಿತ್ ಡಯಾಬಿಟಿಸ್, ನಿಮ್ಗೆ ಗೊತ್ತಾದ ತಕ್ಷಣ ಫಸ್ಟ್ ಐ ಚೆಕಪ್ ಹೋಗ್ಲೇಬೇಕು. ಯಾಕಂದ್ರೆ ಹೊರಗಡೆಯಿಂದ ನೋಡೋದಕ್ಕೆ ಎಲ್ಲಾ ನಾರ್ಮಲ್ ತರ ಕಾಣಿಸಿದ್ರು ಕ್ರಮೇಣವಾಗಿ ಡಯಾಬಿಟಿಸ್ ಮೇನ್ಲಿ ಅದು ನಮ್ಮ ರಕ್ತನಾಳಗಳನ್ನ ಡ್ಯಾಮೇಜ್ ಮಾಡ್ತಾ ಬರುತ್ತೆ. ಆಮೇಲೆ ನಮ್ಮ ಇಡೀ ದೇಹದಲ್ಲಿ ನಾವು ನೋಡ್ಬೋದಾದ ರಕ್ತನಾಳ ಬರೀ ಕಣ್ಣಲ್ಲಿ ಮಾತ್ರ ಕಾಣಿಸೋದು. ನಮ್ ಕಣ್ಣು, ಕಿಡ್ನಿ ಎಲ್ಲ ಒಂದೇ ತರ ಫಂಕ್ಷನ್ ಮಾಡ್ತಾ ಇರ್ತವೆ. ಸೊ ನಾವು ಕಣ್ಣು ಒಳಗಿನ ರಕ್ತನಾಳ ನೋಡಿ ಹೇಳ್ಬೋದು ಯಾವ ಡಿಗ್ರಿಯಲ್ಲಿ ಡ್ಯಾಮೇಜ್ ನಡೀತಾ ಇದೆ ಬಾಡಿಯಲ್ಲಿ ಶುಗರ್ ಇಂದ ಅಂತ. ಸೊ ಫಸ್ಟ್ ಡಯಾಗ್ನೋಸ್ ಆದ ತಕ್ಷಣ ಪೇಷಂಟ್ ಕಣ್ಣಿನ ಡಾಕ್ಟರ್ನ ಕಾಣ್ಲೇಬೇಕು. ಕಣ್ಣಿನ ಡಾಕ್ಟರ್ ಅವ್ರದ್ದು ವಿಜುವಲ್ ಅಕ್ಯೂಟಿ ಅಂತಾರೆ, ಅದೇ ದೂರದ ದೃಷ್ಟಿ ಹೇಗ್ ಕಾಣಿಸುತ್ತೆ ನೋಡಿ, ಕೊನೆಗೆ ಅವ್ರ ಕಣ್ಣಿಗೆ ಡ್ರಾಪ್ ಹಾಕಿ ಚೆಕ್ ಮಾಡ್ತಾರೆ. ಇದು ಒಂದು 10-15 ನಿಮಿಷ ಆಗುತ್ತೆ. ಪಾಪೆ ದೊಡ್ಡದಾದ್ಮೇಲೆ ಹಿಂದಿಂದು ರೆಟಿನಾ ಏನಂತೀವಿ ಅಲ್ಲ, ಅಕ್ಷಿಪಟಲ ಅಂತಾರೆ, ಕನ್ನಡದಲ್ಲಿ. ಅದನ್ನ ನೋಡ್ಬಿಟ್ಟು ಡಯಾಬಿಟೀಸ್ ಅವ್ರ ಕಣ್ಣಿನ ತನಕ ಎಫೆಕ್ಟ್ ಆಗಿದೆಯಾ ಇಲ್ವಾ, ಕಿಡ್ನಿಗಳು ಇನ್ವಾಲ್ವ್ ಆಗಿದಾ ಇಲ್ಲ ಅಂತ ಡಾಕ್ಟರ್ ಹೇಳ್ತಾರೆ. ಬಟ್ ಇದು ಫಸ್ಟ್ ಟೈಮ್ ಬರ್ಬೇಕಾದ್ರೆ ಪೇಷಂಟ್ ಯಾರನ್ನ ಜೊತೆ ಕರ್ಕೊಂಡೇ ಬರ್ಬೇಕು, ಒಬ್ಬರೇ ಬರಬಾರ್ದು, ಡ್ರೈವ್ ಮಾಡಬಾರ್ದು. ಸೊ ಈ ತರ ಎಕ್ಸಾಮಿನೇಷನ್ಗೆ ಒಳಗಾದಾಗ ಪೇಷಂಟು ಆಫ್ಥಮಾಲಜಿಸ್ಟ್ ಡಿಸೈಡ್ ಮಾಡ್ತಾರೆ ಡಯಾಬಿಟೀಸ್ ಸ್ಟಾರ್ಟಿಂಗ್ ಸ್ಟೇಜ್ ಅಲ್ಲಿ ಇದೆಯಾ, ಅದನ್ನ ಮೈಲ್ಡ್, ಮಾಡರೇಟ್, ಸಿವಿಯರ್, ಅಡ್ವಾನ್ಸ್ಡ್ ಅಂತ ಡಿವೈಡ್ ಮಾಡ್ತೀವಿ. ನಂತರ ಪೇಷಂಟ್ಗೆ ಹೇಳ್ತೀವಿ ಯಾವಾಗ ಅವರು ಚೆಕಪ್ಗೆ ಬರಬೇಕು. ಈಗ ಏನೂ ಚೇಂಜಸ್ ಇಲ್ಲದೆ ಮೈಲ್ಡ್ ವೆರೈಟಿಯಲ್ಲಿದ್ರೆ ವರ್ಷಕ್ಕೊಂದ್ಸರಿ ತೋರಿಸ್ಕೋಬೇಕು, ಇಲ್ಲ ಅಂತಂದ್ರೆ 6 ತಿಂಗಳು 3 ತಿಂಗಳು. ಇದು ಡಿಪೆಂಡ್ಸ್ ಆನ್ ದ ಪೇಷಂಟ್ ಯಾವ ಲೆವೆಲ್ ಇದ್ದಾರೆ. ಬಟ್ ಎಲ್ಲಾ ಜನಸಾಮಾನ್ಯರಿಗೆ ಇದೊಂದು ವಿನಂತಿ, ನೀವು ಡಯಾಬಿಟೀಸ್ ಗೊತ್ತಾದ ತಕ್ಷಣ ಮೊದಲು ಮಾಡ್ಬೇಕಾಗಿರೋದು ನೆಕ್ಸ್ಟ್ ನಿಮ್ ಶುಗರ್ ಲೆವೆಲ್ ಕಂಟ್ರೋಲ್ ಆದ ತಕ್ಷಣ ಆಫ್ಥಮಾಲಜಿಸ್ಟ್ ಅಥವಾ ಕಣ್ಣಿನ ಡಾಕ್ಟರ್ನ ಕಾಣ್ಬೇಕು.
ಕಣ್ಣಿಲ್ದೆ ನಮ್ ಜೀವ ಇಲ್ಲ ಅಂತೀವಿ. ಯಾಕಂದ್ರೆ ಒಂದ್ಸಲ ಕಲರ್ಫುಲ್ ಲೈಫ್ ನೋಡಿದ್ಮೇಲೆ ಕಣ್ ಬೇಕೇ ಬೇಕು. ಬಟ್ ಅದೇ ನಮ್ ಕನ್ಫ್ಯೂಷನ್ ಇದ್ದಿದೆ. ಯಾಕಂದ್ರೆ ಕೆಲವು ಡಯಾಬಿಟಿಸ್ ಇದ್ದವ್ರಿಗೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡ್ತಾನೆ ಇರ್ತಾರೆ, ಬಟ್ ಕ್ರಮೇಣವಾಗಿ ನೀವ್ ಹೇಳ್ದಂಗೆ ಅವ್ರಿಗೆ ಕಣ್ಣು ದೃಷ್ಟಿ ಕಮ್ಮಿ ಆಗ್ತಾನೆ ಹೋಗುತ್ತೆ. ಅಂದ್ರೆ ನೀವ್ ಹೇಳಿದ ಪ್ರಕಾರ ದೇ ಆರ್ ನಾಟ್ ಕಾನ್ಸಂಟ್ರೇಟಿಂಗ್ ಆನ್ ದ ಐಸ್ ಅಂತ, ಬರೀ ಡಯಾಬಿಟಿಸ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾತ್ರ ಮಾಡ್ಕೊಂತಾರೆ, ಕಣ್ಣಿನ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡಲ್ಲ ಅಂತ.
ಇಲ್ಲಮ್ಮ, ಮೇಜರ್ ಪ್ರಾಬ್ಲಮ್ ಶುಗರ್ ನ ಲೆವೆಲ್ಸ್ ಕಂಟ್ರೋಲ್ ಮಾಡ್ಬೇಕು. ಶುಗರ್ ಲೆವೆಲ್ಸ್ ಕಂಟ್ರೋಲ್ ಇಲ್ದಾಗ ಕ್ರಮೇಣವಾಗಿ ನಮ್ ಬಾಡಿಯಲ್ಲಿ ಎಲ್ಲಾ ಆರ್ಗನ್ಸ್ ಡ್ಯಾಮೇಜ್ ಆಗ್ತಾ ಬರುತ್ತೆ. ಬಟ್ ಕಣ್ಣಲ್ಲಿ ಏನಾಗುತ್ತೆ, ರಕ್ತನಾಳಗಳು ಡ್ಯಾಮೇಜ್ ಆಗಿರೋದ್ರಿಂದ ಒಂದು ಫ್ಲೂಯಿಡ್ ಅಥವಾ ಲಿಪಿಡ್ ಏನಂತೀವಿ ಅದು ಡಿಪಾಸಿಟ್ ಆಗೋಕ್ ಶುರು ಆಗುತ್ತೆ. ಇದರಿಂದ ನರದಲ್ಲಿ ಊತ ಬರುತ್ತೆ. ಈ ನರ ಊತ ಬಂದಾಗ ದೃಷ್ಟಿ ಕ್ರಮೇಣವಾಗಿ ಕಡಿಮೆ ಆಗುತ್ತೆ. ಕೆಲವೊಂದ್ಸಲಿ ಬ್ಲಾಕ್ ಆಗ್ಬೋದು ರಕ್ತನಾಳಗಳು. ಬ್ಲಾಕ್ ಆದಾಗ ಏನಾಗುತ್ತೆ, ಆಕ್ಸಿಜನ್ ಸಪ್ಲೈ ಇಲ್ಲದೆ ನಮ್ಮ ದೇಹದಲ್ಲಿ ಹೊಸ ರಕ್ತನಾಳಗಳು ಸೃಷ್ಟಿ ಆಗುತ್ತೆ. ಹೊಸ ರಕ್ತನಾಳ ಅಂದಾಗ ನಮ್ಗೆ ಏನನ್ಸುತ್ತೆ, ಒಳ್ಳೇದು, ಹೊಸ ಬ್ಲಡ್ ಬರುತ್ತೆ, ಆಕ್ಸಿಜನ್ ಜಾಸ್ತಿ ಬರುತ್ತೆ. ಆ ತರ ಎಲ್ಲ ಈ ಹೊಸ ರಕ್ತನಾಳಗಳು ಏನಿರ್ತವೆ ತುಂಬಾ ಫ್ರೆಜೈಲ್ ಅಂತೀವಿ, ತುಂಬಾ ಮೃದು. ಏನಾಗುತ್ತೆ, ಒಡ್ಕೊಂಡು ರಕ್ತ ಹೊರಗಡೆ ಸ್ರಾವಾಗಿ ಯೂಶಲಿ ಪೇಷಂಟ್ ಬರೋದು ಹೇಗೆ ಅಂತಂದ್ರೆ ಏನೋ ಕಪ್ ಕಾಣಿಸ್ತಾ ಇದೆ ನಮ್ಗೆ ಅಂತಾರೆ. ಅದು ಒಳಗಡೆನೆ ರಕ್ತ ಬ್ಲೀಡ್ ಆಗ್ಬಿಟ್ಟು ಅದು ಅಡ್ಡ ಬಂದಾಗ ಪೇಷಂಟ್ಸ್ ಪ್ರೆಸೆಂಟ್ ಆಗ್ತಾರೆ. ಸೊ ಯಾವಾಗ್ಲೂ ಜನಸಾಮಾನ್ಯರಿಗೆ ಇದೇ ಹೇಳೋದು, ಇಯರ್ಲಿ ಚೆಕಪ್ ಇಡ್ಬೇಕು ನೀವು. ಇಲ್ಲ ಅಂದ್ರೆ ದೃಷ್ಟಿ ಒಂದು ಹಂತ ಮುಟ್ಟಿದ್ಮೇಲೆ ಜಾಸ್ತಿ ಮಾಡೋದಕ್ಕಾಗೋದಿಲ್ಲ. ಮುಂಚೆನೆ ಬಂದ್ರೆ ವಿ ಕ್ಯಾನ್ ಪ್ರಿವೆಂಟ್ ದೀಸ್ ಆಲ್ ಥಿಂಗ್ಸ್.
Can you just summarize it in English? Many people are asking, they are eager to know about the eyes in English.
Okay.
2 sentences in English. Summary. Yeah.
Okay. The first main thing I want to request all of you is, when you're diagnosed as diabetes, kindly first make a sugar control, then visit your ophthalmologist. Because as you know, eye is the camera. It's like a camera, and what the retina is, it's a reel. Because of the retina, we are able to perceive light and sense light and see this beautiful world. So what happens in diabetes, it is mainly a disease of blood vessels. So blood vessels will be slowly damaging. It is the same process going whole throughout the body in eyes, kidney, heart, everything. But we have an opportunity to see in the eyes. That is, same kidney as well as eye have same kind of blood vessels. So we'll be viewing the eyes. So we'll ask the patient to get dilated and get the checkup done. So in the process, what happens, the ophthalmologist will categorize into mild, moderate, severe and advanced disease. Mild and no diabetic retinopathy can visit the ophthalmologist yearly. This moderate to severe, depending on the severity, the doctor will ask to come every 3 months or every 6 months. And it is very important to keep the follow-up, because this diabetes
misconception. So what we advise as physician is to have a healthy diet. Healthy diet means like, no, they should eat. See, most of them, what is happening now, diabetes as such is coming just because of overeating. See, what we see is like, ivaga iro makkaleಲ್ಲ ನೋಡಿದ್ರೆ ತುಂಬಾ ಒಬೀಸ್ ಆಗಿರ್ತಾರೆ, weight ಜಾಸ್ತಿ ಇರುತ್ತೆ. ಒಂದೇನಂದ್ರೆ ಇವಾಗ ನಮ್ ಎಕನಾಮಿಕಲ್ ಕಂಡೀಷನ್ ಚೆನ್ನಾಗಿರೋದ್ರಿಂದ ಮಕ್ಕಳನ್ನ ಚೆನ್ನಾಗಿ ತಿನ್ಸ್ಬೇಕು ಅಂತ ತಿನ್ಸಿ ಅವ್ರಿಗೆ ಒಂದು 25-30 ವಯಸ್ಸಿನಲ್ಲೇ ಶುಗರ್ ಬಂದ್ಬಿಡತ್ತೆ. ಸೊ ಬರೋದಕ್ಕೆ ಕಾರಣ ಊಟನೇ. ಒಂದು ಊಟ ಮಾಡೋದು ಜಾಸ್ತಿ ಇರುತ್ತೆ, ಇಲ್ಲಾಂದ್ರೆ ಊಟ ಮಾಡಲ್ಲ. ಫೀಸ್ಟಿಂಗ್ ಆರ್ ಫಾಸ್ಟಿಂಗ್, ದಿಸ್ ಇಸ್ ವಾಟ್ ಇಸ್ ಹ್ಯಾಪ್ನಿಂಗ್. ಸೊ ಈ ಫಾಸ್ಟಿಂಗ್ ಅಂದ್ರೆ ಈ ಡಯಟ್ ಅಂತ ಯಾರು ಊಟ ಮಾಡೋದಿಲ್ಲ. ಈ ನೀವು ಹೇಳ್ದಂಗೆ ಶುಗರ್ ಪೇಷಂಟ್ಸ್ ಬಂದ ತಕ್ಷಣ ಡೋಂಟ್ ಈಟ್ ದಿಸ್, ಡೋಂಟ್ ಈಟ್ ದಟ್. ಅವ್ರಿಗೆ ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ, ನಾವು ಊಟದಲ್ಲಿ 2 ಟೈಪ್ ಊಟ ಇರುತ್ತೆ. ಒಂದು ಮೈಕ್ರೋ ನ್ಯೂಟ್ರಿಯನ್ಸ್ ಅಂತ, ಚಿಕ್ಕ ಚಿಕ್ಕ ವಿಟಮಿನ್ಸ್ ಮತ್ತೆ ಮಿನರಲ್ಸ್ ಇದೆಲ್ಲ ಮೈಗೆ ತುಂಬಾ ಇಂಪಾರ್ಟೆಂಟ್. ಸೊ ಇದನ್ನ ಮರ್ತು ಹೋಗ್ತೀವಿ. ಈ ಮ್ಯಾಕ್ರೋ ನ್ಯೂಟ್ರಿಯನ್ಸ್ ಅಂತ ಹೇಳ್ತೀವಿ, ಈ ಪ್ರೋಟೀನ್ಸ್, ಕಾರ್ಬೋಹೈಡ್ರೇಟ್ಸ್, ಸೊ ಎಲ್ಲಾನು ನಾವ್ ಏನ್ ಮಾಡ್ತೀವಿ, ಬ್ಯಾಲೆನ್ಸ್ ಮಾಡಿ ತಿನ್ನೋದಿಲ್ಲ. ಸೊ ನಾವು ಪೇಷಂಟ್ಸ್ಗೆ ಏನ್ ಹೇಳ್ತೀವಿ ಅಂದ್ರೆ, ಈ ಫಾಸ್ಟಿಂಗ್ ಅಂತೂ ಮಾಡ್ಲೇಬಾರದು. ಶುಗರ್ ಪೇಷಂಟ್ಸ್ ಚೆನ್ನಾಗಿ ತಿನ್ಬೇಕು, ಅದು ಇಟ್ ಈಸ್ ಅ ಹೆಲ್ದಿ ಡಯಟ್. ನಾನು ನೆಕ್ಸ್ಟ್ ಡಯಟ್ ಏನ್ ತಿನ್ಬೇಕು ಅನ್ನೋದನ್ನ ನೆಕ್ಸ್ಟ್ ನಾನು ಹೇಳ್ತೀನಿ. ಸೊ ನಾರ್ಮಲಿ ಅಟ್ಲೀಸ್ಟ್ ಒಂದ್ ದಿವಸಕ್ಕೆ 4 ಸತಿ ಅವ್ರು ತಿನ್ಬೇಕು. ಬೆಳಿಗ್ಗೆ ಎದ್ದ ತಕ್ಷಣ 1 or 2 hours ಒಳಗಡೆ ಅವರು ಬ್ರೇಕ್ಫಾಸ್ಟ್ ಮಾಡ್ಬೇಕು. ಬ್ರೇಕ್ಫಾಸ್ಟ್ ಶುಡ್ ಬಿ ವಿತ್ ಇನ್ 1 or 2 hours. ಮತ್ತೆ ಎವ್ರಿ 4 hours ಏನಾದ್ರೂ ತಿನ್ಬೇಕು. ಅದು ಹೊಟ್ಟೆ ತುಂಬಾ ತಿನ್ಬೇಕಂತಿಲ್ಲ, ಅಟ್ಲೀಸ್ಟ್ ಅವರು ಹೊಟ್ಟೆಗೆ ತಿನ್ಬೇಕು. ಈ ಫಾಸ್ಟಿಂಗ್ ಮಾಡಿದ್ರೆ ಏನಾಗುತ್ತೆ, ಚಿಕ್ಕ ಚಿಕ್ಕ ಪ್ರಾಬ್ಲಮ್ಸ್ ಲೈಕ್ ಗ್ಯಾಸ್ಟ್ರೈಟಿಸ್ ಬರ್ಬೋದು, ಈ ವಾಮಿಟಿಂಗ್ ಬರ್ಬೋದು, ಹೊಟ್ಟೆ ನೋವು ಬರ್ಬೋದು, ಉರಿ ಬರ್ಬೋದು, ದೊಡ್ಡ ದೊಡ್ಡ ಪ್ರಾಬ್ಲಮ್ಗಳು ಲೈಕ್ ಅಲ್ಸರ್ ಆಗ್ಬೋದು, ಅಲ್ಸರ್ಸ್ ಕ್ಯಾನ್ಸರ್ ಆಗ್ಬೋದು. ಇಲ್ಲಾದ್ರೆ ಈ ಜ್ಯೂಸಸ್ ನಮ್ಮ ಮೈನಲ್ಲಿ ಸುಮಾರು ಒಂದು 4-5 ಲೀಟರ್ ಜ್ಯೂಸಸ್ ಒಂದ್ ದಿವಸಕ್ಕೆ ಸರ್ಕ್ಯುಲೇಟ್ ಆಗುತ್ತೆ ಹೊಟ್ಟೆನಲ್ಲಿ ಈ ಡೈಜೆಷನ್ ಮಾಡಕ್ಕೆ. ಸೊ ಇದನ್ನ ನಾವು ಹಂಗೆ ಬಿಟ್ರೆ ಗಾಲ್ ಸ್ಟೋನ್ಸ್, ಈ ಗಾಲ್ ಬ್ಲಾಡರ್ ನಲ್ಲಿ ಕಲ್ಲು ಬರುತ್ತೆ. ಆಮೇಲೆ ಪ್ಯಾಂಕ್ರಿಯಾಸ್ ನಲ್ಲಿ ಪ್ಯಾಂಕ್ರಿಯಾಟೈಟಿಸ್ ಆಗುತ್ತೆ, ಯಾಕಂದ್ರೆ ಈ ಜ್ಯೂಸಸ್ ಯುಟಿಲೈಸ್ ಆಗದೆ ಇರೋದ್ರಿಂದ. ಅದರಿಂದ ಈ ಫಾಸ್ಟಿಂಗ್ ಅನ್ನೋದನ್ನ ಮಾಡ್ಲೇಬಾರದು. ಟೈಮ್ ಸರಿಗೆ ಊಟ ಮಾಡ್ಬೇಕು. ನೆಕ್ಸ್ಟ್ ಕ್ವಾಲಿಟಿ ಆಫ್ ಫುಡ್. ಕ್ವಾಲಿಟಿ ಆಫ್ ಫುಡ್ ಅಂದ್ಮೇಲೆ ನಾವು ಈ ಫುಡ್ ನಲ್ಲಿ ನಾನು ಹೇಳ್ದಂಗೆ ಮ್ಯಾಕ್ರೋ ನ್ಯೂಟ್ರಿಯನ್ಸ್, ಕಾರ್ಬೋಹೈಡ್ರೇಟ್ಸ್ ಅಂದ್ರೆ ಈ ಅಕ್ಕಿ, ರೈಸ್, ಮತ್ತೆ ಈ ಮಿಲೆಟ್ಸ್, ಗೋಧಿ, ಇದೆಲ್ಲ ಕಾರ್ಬೋಹೈಡ್ರೇಟ್ಸ್. ನೆಕ್ಸ್ಟ್ ನಾವು ಊಟದಲ್ಲಿ ಪ್ರೋಟೀನ್ಸ್ ಅಂದ್ರೆ ವೆಜಿಟೇರಿಯನ್ ಪ್ರೋಟೀನ್ಸ್, ಬೇಳೆ, ಕಾಳು, ಇದೆಲ್ಲ ವೆಜಿಟೇರಿಯನ್ ಪ್ರೋಟೀನ್ಸ್. ನಾನ್ ವೆಜ್ ಪ್ರೋಟೀನ್ಸ್ ಅಂದ್ರೆ ಎಗ್ ವೈಟ್, ಮತ್ತೆ ಚಿಕನ್, ಫಿಶ್, ಈ ತರ ನಾನ್ ವೆಜ್ ಪ್ರೋಟೀನ್ಸ್, ಇದು ಇಂಪಾರ್ಟೆಂಟ್. ಮತ್ತೆ ಥರ್ಡ್ ಒನ್ ಇಸ್ ಫೈಬರ್ಸ್ ಬೇಸಿಕಲಿ ಏನ್ ಬರುತ್ತೆ ಅಂದ್ರೆ ಫ್ರೂಟ್ಸ್ ಇಂದಾನು ಬರುತ್ತೆ, ವೆಜಿಟೇಬಲ್ಸ್ ಇಂದ ಬರುತ್ತೆ. ಸೊ ವೆದರ್ ಶುಗರ್ ಪೇಷಂಟ್ ಆರ್ ನಾನ್ ಶುಗರ್ ಪೇಷಂಟ್ಸ್ ಇದನ್ನ ಈ ಕಾಂಪೋಸಿಷನ್ ನ ಫಾಲೋ ಮಾಡಬೇಕು. ದಟ್ ಈಸ್ ಮೋರ್ ಇಂಪಾರ್ಟೆಂಟ್. ಪ್ರತಿ ಸತಿ ಬೆಳಗ್ಗೆನೋ, ಮಧ್ಯಾಹ್ನನೋ, ಸಾಯಂಕಾಲ, ನೈಟ್ ತಿನ್ಬೇಕಂದ್ರೆ ಅವ್ರದ್ದು ಅಟ್ಲೀಸ್ಟ್ 50% ಆಫ್ ದೇರ್ ಮೀಲ್ ನಲ್ಲಿ ಫ್ರೂಟ್ಸ್, ವೆಜಿಟೇಬಲ್ಸ್ ಸೇರ್ಸ್ಕೊಳ್ಬೇಕು. ಇದ್ರಲ್ಲಿ ಏನ್ ಸಿಗುತ್ತೆ ಅಂದ್ರೆ ಈ ಮೈಕ್ರೋ ನ್ಯೂಟ್ರಿಯನ್ಸ್ ಅದರಲ್ಲೇ ಇರೋದು, ಈ ವಿಟಮಿನ್ಸ್ ಮತ್ತೆ ಮಿನರಲ್ಸ್, ಇದು ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಸೊ ಡಯಾಬಿಟಿಕ್ ಪೇಷಂಟ್ಸ್ ನಲ್ಲಿ ಆಲ್ರೆಡಿ ನಮ್ ಡಾಕ್ಟರ್ ಸಂಜೀವ್ ಸರ್ ಹೇಳ್ದಂಗೆ ಕಾಂಪ್ಲಿಕೇಶನ್ಸ್ ಸಿಕ್ಕಾಪಟ್ಟೆ ಬರುತ್ತೆ. ಈ ಕಾಂಪ್ಲಿಕೇಶನ್ಸ್ ಬೇಸಿಕ್ಲಿ ಏನಾಗುತ್ತೆ, ಹೈ ಶುಗರ್ ಇಂದ ಬರುತ್ತೆ, ಮತ್ತೆ ವಿಟಮಿನ್ ಡಿಫಿಷಿಯನ್ಸೀಸ್. ನೀವು ಸುಮಾರು ಡಾಕ್ಟರ್ಸ್ ಹತ್ರ ನೀವು ನೋಡಿದ್ರೆ ಏನೋ ಡಾಕ್ಟರ್ ಒಂದು ವಿಟಮಿನ್ ಟ್ಯಾಬ್ಲೆಟ್ ಬೇರೆ ಬರೀತಾರೆ, ಶುಗರ್ ಟ್ಯಾಬ್ಲೆಟ್ ಜೊತೆ ಬರೀತಾರೆ. ಶುಗರ್ ಟ್ಯಾಬ್ಲೆಟ್ ತಿನ್ನೋದೇ ಕಷ್ಟ, ಇನ್ನೊಂದು ಟ್ಯಾಬ್ಲೆಟ್ ಬೇರೆ ಎಕ್ಸ್ಟ್ರಾ. ಯಾಕಂದ್ರೆ ನಮ್ ಡಯಟ್ ಆ ತರ ಇದೆ, ಯಾರು ಹೆಲ್ದಿಯಾಗಿ ತಿನ್ನೋದಿಲ್ಲ. ಅದರಿಂದ ಏನ್ ಮಾಡ್ತೀವಿ ನಾವು, ಟ್ಯಾಬ್ಲೆಟೇ ಬರಿಬೇಕಾಗತ್ತೆ. ಮತ್ತೆ ಪ್ರೋಟೀನ್ಸ್ ಏನ್ ತಿನ್ಬೇಕಂದ್ರೆ ಹೊಟ್ಟೆ ತುಂಬಾ ಅನ್ನ ತಿನ್ಬೇಕು, ಇಲ್ಲಾಂದ್ರೆ ಮುದ್ದೆ ತಿನ್ಬೇಕು. ಡಯಟ್ ನಲ್ಲಿ ಇರ್ತೀನಿ ಸರ್, ನಾನು ಬರೀ ಚಪಾತಿ ತಿಂತೀನಿ ಅಂತಾರೆ. ಎಷ್ಟ್ ಚಪಾತಿ ತಿಂತೀರಾ ಅಂದ್ರೆ 4 ಚಪಾತಿ 5 ಚಪಾತಿ. ಅದೇನಾಗುತ್ತೆ, ಕಾರ್ಬೋಹೈಡ್ರೇಟ್ಸ್ ಜಾಸ್ತಿ ಬರುತ್ತೆ, ಮತ್ತೆ ವಿಟಮಿನ್ಸ್ ಮಿನರಲ್ಸ್ ಸಿಗೋದಿಲ್ಲ. ಸೊ ನಂದ್ ಅಡ್ವೈಸ್ ಏನಂದ್ರೆ, ಕರೆಕ್ಟ್ ಆಗಿ ಊಟ ಮಾಡ್ಬೇಕು, ಹೆಲ್ದಿಯಾಗಿ ಊಟ ಮಾಡ್ಬೇಕು, ಈ ಪೋರ್ಷನ್ಸ್ ಕರೆಕ್ಟ್ ಆಗಿ ತಗೊಳ್ಬೇಕು. ಈ ಡಯಾಬಿಟಿಕ್ ಪೇಷಂಟ್ಸ್ ಅಂದ್ರೆ 1 ಕಪ್ ಕಾರ್ಬೋಹೈಡ್ರೇಟ್ಸ್, ಮೇ ಬಿ ರೈಸ್ ತಗೊಂಡ್ರೆ ಅದ್ರ ಜೊತೆ ಅಟ್ಲೀಸ್ಟ್ 1 ಕಪ್ ಪ್ರೋಟೀನ್ ತಿನ್ಬೇಕು. ನಮ್ದ್ರಲ್ಲಿ ಪ್ರೋಟೀನ್ ಡಿಫಿಷಿಯನ್ಸಿ ಸಿಕ್ಕಾಪಟ್ಟೆ ಇರುತ್ತೆ. ಯಾಕಂದ್ರೆ ನಮ್ದ್ರಲ್ಲಿ ಈ ಬರೀ ಸಾಂಬಾರ್ಗೆ ಹಾಕೋ ಇದ್ರಲ್ಲಿ ಮಾತ್ರ ಸ್ವಲ್ಪ ಪ್ರೋಟೀನ್ಸ್ ಇರುತ್ತೆ. ಸೆಪರೇಟ್ ಆಗಿ ಪ್ರೋಟೀನ್ಸ್ ತಿನ್ನೋದು ತುಂಬಾ ಕಡಿಮೆ. ಅದು ನೀವು ವಿಲೇಜ್ ನಲ್ಲಿ ತಿಂತಾರೆ, ಯಾಕಂದ್ರೆ ಅಟ್ಲೀಸ್ಟ್ ಅಲ್ಲಿ ಟೈಮ್ ಇರುತ್ತೆ ಅಡಿಗೆ ಮಾಡಕ್ಕೆ, ಕುಕ್ ಮಾಡಿ ತಿನ್ನೋದು. ಇಲ್ಲಿ ಬೆಂಗಳೂರಿನಲ್ಲಿ ಮೆಟ್ರೋಸ್ ನಲ್ಲಿ ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ, ಈ ಫಾಸ್ಟ್ ಫುಡ್, ಪೀಪಲ್ ಟ್ರೈ ಟು ಗೋ ಟು ಫಾಸ್ಟ್ ಫುಡ್. ಫಾಸ್ಟ್ ಫುಡ್ ಇಸ್ ವಾಟ್ ಅಂದ್ರೆ, ಇಟ್ ಇಸ್ ಮೋರ್ ಆಫ್ ಅ ರಿಫೈನ್ಡ್ ಫುಡ್. ಇಟ್ ಕಂಟೈನ್ಸ್ ಮೋರ್ ಕ್ಯಾಲರೀಸ್, ಎಸ್ಪೆಷಲಿ ನೀವು ಕಾರ್ಬೋಹೈಡ್ರೇಟ್ಸ್ ಜಾಸ್ತಿ ಇರುತ್ತೆ ಕ್ಯಾಲರೀಸ್, ಬಟ್ ಅದರಲ್ಲಿ ಈ ವಿಟಮಿನ್ಸ್, ಮಿನರಲ್ಸ್ ಎಲ್ಲ ಒಟ್ಟೋಗಿರುತ್ತೆ. ಅದೆಲ್ಲ ಏನು ಇರೋದಿಲ್ಲ. ಸೊ ಅದರಿಂದ ಮೈ ಅಡ್ವೈಸಸ್, ಈಟ್ ಹೆಲ್ದಿಲಿ. ಸೊ ಎವ್ರಿ ಮೀಲ್ ನಲ್ಲಿ ಸೊಪ್ಪು, ತರಕಾರಿ, ಹಣ್ಣುಗಳು ಸೇರಿಸ್ಕೊಳ್ಬೇಕು. ಡಯಾಬಿಟಿಕ್ ಪೇಷಂಟ್ಸ್ ನಲ್ಲಿ ಈ ಸ್ವೀಟ್ ಆಗಿರೋದು ಹಣ್ಣುಗಳ ಬಿಡಬೇಕು. ಸೊ ಗೋಯಿಂಗ್ ಫಾರ್ವರ್ಡ್ ಕ್ವಶನ್ಸ್ ಬಂದಾಗ ವಿ ಕ್ಯಾನ್ ಡಿಸ್ಕಸ್ ಅಬೌಟ್ ವಾಟ್ ಟೈಪ್ ಆಫ್ ಫುಡ್ ಇಫ್ ದೇ ರಿಕ್ವೈರ್, like if somebody is asking. So this is my advice. Anything you have a question, you can just ask me.
Sure. Dr. Amla Selvam, thank you so much. ನೀವು ಹೇಳಿದ್ very important. Healthy diet is not fasting, but it's basically eating right food at the right time also. So ಈಗ ಬಹಳ ಜನ ಹೇಳ್ತಾ ಇದ್ರು, people with diabetes generally they carry biscuits with them and they eat ಅಂತ. Now I understand why they always carry something, so that they eat at every interval, they eat something ಅಂತ. So even biscuit is enough, right? Or we have to carry fruits with us?
ಇಲ್ಲ, that is also a wrong conception. ಈ ಬಿಸ್ಕೆಟ್ ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ, it's a refined food. Again, I will advise not to eat.
Okay.
But ಏನಾಗುತ್ತೆ
No, because I heard lot of people say that.
No, something to carry. ಒಂದೇನಂದ್ರೆ ನೀವು ಹೇಳ್ದಂಗೆ working class of people cannot carry fruits or any other like salads or something atara carry ಮಾಡೋಕೆ difficult irutte, so they are taking biscuits, but that is only to like if they are not having an access to have a proper meal, then they can take it. Otherwise it is not a good idea.
Okay.
But eating
Yeah, because
on
I've
regular
heard people.
that's right.
Okay.
ಅದು ಸುಮಾರು
Yeah,
ಸತಿ
ನಾನು
ಏನಾಗುತ್ತೆ,
ಕೇಳಿದ್ದೆ ಹಂಗೆ.
ಮೆಡಿಸಿನ್ಸ್
Can we
ತಗೊಂಡಿರ್ತಾರೆ.
take some questions from the audience now before we go on to the next round? And I think after, I don't know if you want to finish Dr. Sridhar, and then we can do that.
Yeah. I think Dr. Sridhar is there. Okay. We have Dr. Manoj. Shall we take one or two questions before I go to Dr. Vijay Kumar and Dr. Sridhar? Okay, one. Okay. First question we had received was from Vinod Suta. What he's telling is he's 71 years old. 11 years back, he was put in insulin immediately after bypass surgery. His question is it possible to switch over to oral medication instead of depending on insulin lifelong? My HbA1c remains below 7 only. So, which doctor would like to answer this question?
Sanjana sir, you want to answer it?
Okay. See, with the current armamentarium of medicine that we have, a trial of this can be done to see if you can be weaned off your insulin or not. Again, there is no definite yes or no. You have to initiate medicines and gradually reduce your insulin, and then probably, if you are okay with the sugars and everything under control, you can be weaned off.
So, Mr. Vinod Sutta, I think Dr. Sanjeev Rao has answered your question. I think you could best consult your doctor and get it sorted out. There's one more question that's come. Is there a complete cure for diabetes? I have come across a group led by a physician who says practice of certain yoga, asanas, and strict control on our diet, we will completely cure. Okay, I think this question we'll pose it to Dr. Vijay Kumar once I ask him the questions. I'll do that. So I'll come to Dr. Vijay Kumar. Sir, before I asked you, only this question came up. As we said with diet, that the people advise us to eat this and not this. There's another thing that also adds on to this is they start saying exercise is a cure for all diseases. So how does exercise actually play a role in the control of diabetes? And is it that we have to do a particular type of exercise, or is it sometimes exercise is too much or too less? How do we balance all that, Dr. Vijay Kumar?
Yeah, see, the word cure is a very big word actually. It's not as it seems. Cure is not there. We can say manage. See, first thing is exercise is a must for healthy lifestyle. That is agreeable with everybody. Physical activity, we say. Physical inactivity. So ಅಂದ್ರೆ ದೈಹಿಕ ಚಟುವಟಿಕೆಗಳು ಮಾಡದೆ ತುಂಬಾ ಕಡಿಮೆ ಮಾಡೋರು, very less physical activity has shown to significantly influence on the problems of any disease, especially in coming to diabetes. So diabetes control to a larger extent can be done basically by good physical activity and regular physical activity. Here, if we see, physical activity is a little larger understanding, where exercise is a component of physical activity. So exercise is something that is to be done in a particular fashion, particular mode, particular type, and repeatedly. While physical activity at a large is combined with exercise and what all your body can do throughout the day. So it's a complete set that is called physical activity. It is said that when you are physically active throughout is basically very much required for a normal healthy lifestyle. While exercise is recommended as a part of any disease management, in diabetes it goes, or in even any other chronic diseases, it goes in a larger way to even control or prevent the progression of the particular disease, especially diabetes. So this is the basic concept we need to understand. So apart from this, a refreshing sleep, adequate rest, and recovering from all the regular physical activity is very essential when there is all this activity is done. So without that, straining yourself also, on the other hand, take you to another problem. So balancing is very important. And to coming to the glucose management in exercise. So we'll have to first understand what happens to the glucose metabolism in the body when we are doing exercise. So there are a lot of changes that happens. Basically, there are two different types of exercise. We call it aerobic and anaerobic, depending on the type and intensity of the exercise that is being done or the physical activity that is being done. First thing what happens when you start exercising, there is in generally a normal human being uses about 4 grams of glucose that is there in the blood regularly at a time, any particular time. But when you start exercising, the glucose is raised in the blood. This is coming from the storage, basically the liver. So when this lot of glucose is as a stimulant comes from the liver, it is produced and it is coming into the blood because of the usage during exercise, depending on what you exercise. So this is a dynamic process. This type of interaction and mechanism and understanding within the body and the liver is a certain somewhat lost in those who are having diabetes. This is basically because the cells in the body are little adamant to utilize the glucose. So this utilization of glucose is basically helped by insulin. So the interaction between insulin, glucose production and utilization in the body, when there is a disturbance between all these things, there is going to be a high or low sugar levels in the body that occurs. When exercise is there, we need to, what happens is the cells will start improvising in utilizing the glucose. So over a period of time, when you're doing all this exercise regularly, there is a balance that is coming and understanding within the body. So the maintenance of glucose, too much of high glucose and low glucose will be avoided by regularly doing exercise. So the cells become more sensitive to utilize the glucose. This is how the exercise helps in maintaining diabetes, apart from medicines and diet. So this is the basic understanding of why exercise is so important in diabetes.
Just to add a bit to it, if you want to just specifically at least 150 minutes of exercise per week. Okay, with not more than 2 days gap. You should not give more than 2 days gap. And among 5 to 6 days, we need to work out. And among that 2 days, we should concentrate on strength training. Previously, we never used to advocate strength training. So building muscles improves our sugar control is the newer concept. And latest guidelines also says flexibility exercise like yoga also should be there. So it should be a mix of all exercises, at least 150 minutes. Latest guidelines says 150 to 300 minutes would be even more beneficial with adequate rest and recovery.
150 minutes. That's the mantra now. We have to follow. And as you said, it's just not for diabetes. It's good for all people to stay healthy. But one extra thing I liked about what Dr. Vijay Kumar said is we always talk about exercise, but very rarely we talk about sleep and the required amount of rest we need. So I think along with exercise, the right amount of quality, good sound sleep is also very important for our body to regenerate and be fresh every day morning. So, Mr. Pawan, I think Dr. Vijay Kumar explained to you, gave you the answer that exercise or yoga, whatever, it's not curable, it's manageable. Yes, Dr. Vijay Kumar.
Yeah, I want to add to the question what Mr. Pawan has asked. See, we'll have to understand. We can't talk about cure. It's a very large thing. Definitely we can manage, and there is something called remission. By doing a very strict planned approach, lot of physical activity and keeping the glucose levels below or even normal range by different methods, eventually there will be a decrease in the medications, and over a period of time he can go into a remission depending on the profile. Not everyone can be achieving this. So there are some profiles. It is a separate guided program where people can achieve this, and remission can be 1 year to 5 years depending on the patient profile.
Okay, so there is some silver lining at the end of every dark cloud. So that's a nice thing that we got from you, Dr. Vijay Kumar. Thanks so much. Okay, I will talk to Dr. Sridhar before come back to a few more questions that our viewers are asking in. Dr. Sridhar, the important fact that we're going to ask you about is insurance. And generally, when we apply for health insurance, if you have diabetes, a lot of people don't even give you insurance. But even if they give insurance, we have at least 4 years of gap period before they start giving us any payment. But I've also heard that there are some special diabetic insurance for diabetic people. So this is a world full of confusion for us. If you can explain to us some details of whether these insurances are necessary or if you should take or no, what's your take on it?
Good evening, Shubha Sanjay Ellaru. So, with regarding to the insurance, as everybody knows that at this point of time or the pandemic situation has really put everybody in a crisis moment, especially who are not covered with insurance. I just want to tell you that, a few things before I answer your question, Pratibha. Why insurance is
Sure,
required, basically. If I want to broadly say that, one is like we have to insure yourself because to fight the lifestyle diseases. As you know, diabetes, hypertension, respiratory problems, these are all lifestyle diseases generally that will occur, post middle age, like, after 45, especially, like, people have to be very careful. And the early you start, you are going to get the better cover. Then second is to safeguard your family. As you know, like the medical inflation is going over the roof, and or added to that is this COVID-19, where the hospitals are going to definitely have more incidental expenses. Then we need to have an adequate cover so that there will be no financial burden as you go and make any kind of a claim, because that is one of the major factors of diluting the assets, especially to pay the bills of the hospital. And of course, like, it will also protect your savings, because as you know, if you are covered in the insurance, then you will be able to have a peaceful sleep. The reason being, if we have to have a admission or the hospitalization in a tertiary care hospitals, like Apollos or Manipals or Columbia Asias, like, and if we feel that yes, we have to get admitted over there, and if you don't have an insurance, then definitely people will think 100 times, because it's definitely going to pinch their pocket. Now, I would like to answer your question that, especially on the diabetes part, like, how it can be covered. Now, as you all know, there are different kinds of insurance. One is the health, another is the life insurance. Now, coming to the question of yours will come under the health insurance, actually. So in the health insurance, there is a traditional product, what we call mediclaim policy. Okay, now, if we have to talk about this, like, if a person has to take a policy, he has to take it early. And generally what happens, up to 4 years, the pre-existing diseases are not covered. But now, when the liberalization of the insurance has happened through IRDA, what we call, who is a regulator for insurance, has released or given the approvals for many of the insurance companies to come out with a specific product which is related to diabetes. Now, I do not want to go and tell you which are the companies, but few name, like we have Star, we have Apollo, we have Max. They have come out with the insurance products which can cover the insurance for diabetes and its complications within 1 year, or sometimes after 1 month itself, by paying some additional premium. The traditional insurance policies will actually will cover after 4 years if you are detected with diabetes. But otherwise, these kind of insurance companies are going to, cover you from almost 1 month, after 1 month, because up to 1 month, no, unless it's an accident, it will not be covered. So definitely, you will have to start taking the insurance much early, so that you can pass on that 1 year or so. Even if you go for a traditional insurance, which is going to have a 4 years lock-in period for pre-existing diseases, when you are young, if you're taking it, then the 4 years will pass. and definitely you will be able to get a advantage over there. So I always recommend that people should take the insurance seriously, and then go ahead. I'm not here to promote. I mean, I am a diabetologist, and I'm also a certified, qualified person in the insurance segment through National Insurance of Academy. So I have seen the both sides of the. I mean, I am in the both sides of the practice on the insurance as well as in the practice. So what my suggestion is, please start early and ensure that you are going to have a sufficient insurance covered, so that it should not have any burden. Do something today that your future self will thank you. Hope I have answered you, Pratibha, on this.
Yeah, Dr. Manohar.
Well, as a doctor, as an insurance specialist, see how hesitant we are to advise insurance. But if you do not have your motor vehicle insurance, it is a crime. But if you do not have a health insurance, it's not a crime. I think the policy makers that's where our Mr. Suresh should come into play. Like, it's a crime not to have a vehicle which is costing 50,000, but your body is priceless. And see the amount of inertia which is being brought on, so that even a expert like him is hesitant to say everyone should get insured. He is thinking 10 times. So he thinks maybe it is a marketing attitude, what is people would see it as. But if you do not have an insurance for your vehicle, then it's a crime. So I think people should think over, government should think over it, and then that should be the case. That's what my point I wanted to make.
I guess, Dr. Manohar, our next agenda will be that is to make at least health insurance compulsory for everyone. But as Dr. Sridhar said, it's apt is that everyone should have an insurance and do it as early as possible. So you are covering every aspect of your journey. Any small injury, any small disease is covered. Not that when you get the disease, then is when you start thinking about insurance. So hope it reaches our public and people know, as Dr. Manohar aptly said, motor insurance is, without that you can't ride your vehicle out on the road. So let's make it a health insurance also must to get out of our house also. In the house also we do need it, but let's make it a thing. So thank you so much, Dr. Sridhar, for that bit of very important advice to our community. I would like to ask, there are a few more questions that have come on board. Dr. Manu, can I just pose those questions?
Yes, please.
Yeah, there's again Pawan who's asking, medicine given to control diabetes will have effect on kidneys. Is that true? He's asking. Which doctor would like to
treating diabetes is not costly. Not treating diabetes would be very costly, and this is the common question what people ask. My relative was a diabetic and he was on medicines. That's why his kidney got affected. One thing I would like to bring to the notice of all the public is, if the drug is worse than the disease, it will never be launched and marketed in the world. I know people nowadays, it's an era where we don't believe anyone. But how can we, because there is most of the drugs, unlike the people thinking, for example, COVID, which gets killed by a 2 paise soap, it doesn't have a cure or a treatment specific for it. Why? Because for a drug to be launched in the market for any disease for that matter, not just diabetes, it takes at least 10 years. It goes through rigorous clinical research process from the labs to the trials, which are caused as phase 1, 2, 3, and 4 trials and post-marketing trials. So for a drug to reach the public, it takes at least 10 years. And that would have usually been studied. Having said that, there are definitely some side effects and adverse effects of the drugs, but drugs can't be worse than the disease itself. Rarely someone can have an anaphylactic reaction or an adverse reaction, but the risk-benefit ratio is weighed, and then only the drugs will hit the market. So please do not go with this notion. Any complications, as Dr. Sanjay Rao clearly explained, from head to toe, all the organs can get affected by diabetes. Drugs will not cause the disease, but in certain conditions, certain drugs should not be used. That the doctor is the best judge for it. So that's what I would like to control diabetes. Do not let diabetes control you.
That's very nice. Let diabetes not control you, Dr. Manohar. Thank you so much for that. Now, Dr. Amla Selvam, there is one question from our viewer. They say many people advise sugar patients not to eat rice and chapati. What exactly answer would you like to give them?
See, actually, chapati and rice are the basic meal in an Indian food.
Yeah.
So we don't advise not to eat. It is only the right composition. So what we advise is like, no, this carbohydrate, rice or chapati should be taken only about 25%. See, it's a simple example. Like, no, as I said, like chapatis, people say like, no, since I'm a diabetic, I'm eating chapati. So how much is the quantity? That is important. See, if they are eating some 4 chapatis and no proteins and no vegetables in it, then it is a problem for a diabetic patient because the sugars will not come down. Suppose the patient takes like, no, 1 chapati, then along with it a cup of protein, maybe it's a vegetarian or a non-vegetarian protein, and 2 cups of maybe a salad or a fruit. That will be a right composition. Even rice can be eaten all the 3 times, all the meals he can include rice. But again, it matters the quantity of the rice. So the major meal, what I would suggest is the vegetable will be the major meal. Rice will be part of the meal, a smaller quantity. So this combination, see, we don't advise don't eat this or that. You can eat anything, but only thing the right composition is important.
Okay. So the
Dr.
right
Sanjeev
quantity,
Rao
right?
is a good proponent of diet. I don't know if Sir can bring in his views. It would be very interesting.
Okay. All right. All right. Now, most of these chaps I have taught, so they know what I say. All right. Okay. Now, remember, just to take off from where Amal Selvam has spoken, it is important for the patient to be told that he can have what he normally eats. For example, now he has chapati. Please ensure it is not maida. It is whole wheat chapati. Because the whole wheat chapati will contain a lot of fiber which will bind the sugar and the glucose in the food and prevent it from getting in from the intestine into the body, thereby reducing the glucose going into the sugar body. Second, if you are going to have rice, as Amal Sadan perfectly said, quantity is important. The quality is you should not have white polished rice. You should have red rice, brown rice, boiled rice, parboiled rice, because it is covered with again a fiber. And this fiber acts as a trap. This trap prevents the glucose from going out, so thereby reducing the amount of glucose surge after eating, sugar going up after eating a meal. Similarly, again, when you eat salad, you eat a lot of vegetables. They contain fiber which traps. So it is just not what you eat, but the processed food, which is away from nature, that is very important. For example, when you eat a fruit, you eat, like he said, orange juice and orange. You eat the orange because, again, the fiber traps the sugar. So that is very important.
Thank you, doctor. But we have always heard, right? Avoid all foods with white in color. So I think this is exactly what they're saying.
That's
Anything
very
white is,
simple.
yeah.
You can't give a person, an Indian chap, to eat a Mediterranean diet, which will look at you and walk out.
Yeah.
You have to give what is he eating every day. And whether you eat rice, ragi, millet, chola, it's all the same. 30 years ago, ragi was the in thing.
Yeah.
Everybody thought 30 years ago, you must eat ragi, don't eat chapati, don't. Then came chapati. Everybody must eat chapati, not now it is millet.
Yeah.
Next decade, we don't know what it will come. So every year there is a fad. Now in between they had oats also, don't forget.
Yeah, oats was a full trend. So, doctor, you say that whatever is that we eat, but we eat it in limited quantity and not processed foods at the most. Yeah.
Yes. The closer you are to nature, the healthier you are.
Let's keep that as a mantra now for whatever disease come closer to nature. Yeah, that is best. Thank you so much, doctor. There's one more question posed to Dr. Vijay Kumar. The question reads like this: you spoke about managing diabetes. My question is there any research going on to find permanent cure for diabetes? I think it's already told that you have to manage, but in the future, continuous management can be avoided and it can be permanently fixed with some medicine. Basically, I want to know if researchers are thinking about different solutions for this old problem.
Definitely, there is right from the time when diabetes is known, lot of research, thousands of research has been going to cure. All research are focused on curing, but still the complete light is not seen. So, like we talked earlier, and Dr. Manohar has told, we can remission. Basically, what we have to understand is diabetes is a disease of lifestyle. It means that there is some wear and tear in your bodily functioning. So we will have to manage, not think about curing. Manage in the hello.
Yeah. Yeah, please do,
Manage
doctor.
in the direction so that it is not progressed very fast. At least slow down the progression of the problem. This is the main aim of treating diabetes and managing diabetes. Cure will come if you do some extra work and depending on some profile. But again, cure is a larger word, very controversial word. Remission is the term which not everyone fits in, but a guided program, some people can achieve it.
So I think there's one last question that it's on board. What are the implications of diabetes on people who are immune compromised, like people living with HIV? So which doctor would like to answer this question?
So, I'll take
Yeah,
it.
yes, Dr. Sanjay.
You are having a double whammy here. First of all, diabetes compromises your immunity. HIV will further improve or decrease your immunity. So 1 plus 1 does not become 2. 1 plus 1 becomes 11. So you are having a double whammy here. So you got to be, and see, when you're trying to treat HIV, you have to also keep looking at the other things like his cholesterol, his cholesterol, then his what is his hemoglobin. It's just not treating medicine for HIV virus alone. You're going to look at other things also at the same time, because this is a disease like diabetes which will affect everything. So if you know, it is a saying in medicine that if you know HIV, if you know diabetes, you know medicine. So you have to be very careful, and you got to be extremely careful and vigilant. It does not mean you have got to be a recluse. You can lead normal lives, everything is fine, but you got to be vigilant and act quickly. That's all you have to do.
So acting quick here is important. I think there are a couple of
vigilance is the most
vigilant.
important.
Yeah. So there are a couple of another questions from anonymous attendees. I will just post them. The question is, why wife is type 2 diabetic and she's pregnant now. Sometimes during the course, her sugar levels will drop below 60. What will the effect on fetus be, and how is it? That's how the question is.
Anybody taking it?
Yeah, pregnancy diabetes is a very tricky situation to treat. Not the easiest of the situations to handle. The targets what we give it to the pregnant ladies to minimize the complications are quite stringent as compared to the targets what we set for the general public who are not pregnant or the other people. In the sense, if you're seeing a plain diabetic without any other complications of kidney and heart, we say the fasting sugar should be anywhere between 110 to 130 milligram. Yeah. Postprandial or the random sugar should be around 160 to 180 milligram per deciliter. But when it comes to pregnancy, it's slightly a different ball game. More intense monitoring and treatment is advised. So usually we do a pre and 1 hour post meal sugars and less than 90 of before meal and less than 140 of after 1 hour after meal are the target. So in this process, what happens? It's not easy to treat them. There will be quite a bit of a yo-yo or fluctuations of the sugar. See, this question is very difficult to answer. It should not cause if it is 1 or 2 episodes, but when the sugar is treated immediately. If there are symptoms quite low, like take something, it could be a diet or a sweet, anything. Think about it, what happens. Did I delay my meal? Is it happening regularly? or I'm having any kid also be pushing the sugar low. This is in the general public. So for this case, what I would suggest is kindly maintain a chart and please get back to your doctor at the earliest, the diabetologist. And in pregnancy, they need to meet the diabetologist much more frequently than what we meet in the otherwise when they are non-pregnant. So it is a difficult situation to manage, but kindly get back to your diabetologist.
Doctor, the question he asked was, how does it affect the fetus? Is there any effect on the fetus if the sugar level drops so low?
That's what. If it is a one-odd event, it may not do any problem. But if it is recurrent hypoglycemia, first fix the cause. Secondly, yes, there could be changes in the size of the fetus, and diabetes itself can affect the pregnancy adversely. That's why we treat it. So sometimes the fetus can be large for its size. The risk of them having malformations, certain neural malformations are more, and the risk of getting cesarean sections are much higher in that context. But then again, it is just a caution. These are the complications to be aware of. Treat it aggressively, and then we can definitely avoid the complications.
Thank you, Dr. Manohar. I think there's one last question now. This is from Raghavendran. As age is advancing, many pre-existing illness can be present. And is it good for old people to have insurance? So it's for insurance question.
Dr. Sridhar.
Sridhar. Doctor, you're on mute.
Just repeat the question, please.
Yeah, just as age is advancing, many pre-existing illness can be present. And is it good for old people to have insurance?
Yes, definitely, because the one drawback or a problem that as in the present scenario is the first time if the person wants to take an insurance, there is a cap of up to 65 years. If a person has to take insurance above 65 years, then it's very difficult to get the insurance because he has to undergo a lot of medical examinations, and he has to be certified. Then they may be excluding the diseases from the policy. So the earlier the better. If you can start before 65, then it can get covered up to lifelong as well. So definitely it is advisable to start the insurance much before you reach 65 years.
Thank you so much, Dr. Sridhar.
I would like to add one more thing here. Like if someone comes in for taking a policy and you tell him you need to undergo some test, many people are put off by that. I really can't understand why is it. If someone is testing, many times we have unearthed many diseases, let alone diabetes. So people should be looking forward to get themselves checked and get insured.
They generally run away, doctor. If you know that if you say get medical, they don't come back for the policy. I've seen that in a lot of cases.
Yes.
They're so afraid. I don't know why they're afraid to take a test like that.
We believe in recognition is half solution. So why don't you recognize and then take adequate steps accordingly?
It's always, I say that, it's better to be safe than to be sorry. Like, it's always good to know your health status. And even if you get detected of some ailment, and there is definitely the entire, there's a very good doctors fraternity across the world. And so you will get treated. But I don't know why people do hesitate in getting the medical examinations. I mean, they say that, you have to undergo medical examinations. So I think the awareness in the insurance space is definitely going to help a lot.
A lot of awareness programs, Dr. Manohar, on your list to do now. Okay, no, yeah, because earlier we do insurance is better, and as you said, medical examination is very important because once disease is detected, diagnosed properly, then you have a chances of getting better faster than dragging it along all your life.
And just to add on, there is one policy called red carpet policy where you need to go undergo medicals.
Sorry.
This is one of the companies that start. They are promoting any medicals up to 65 years.
Okay.
60 to 65, you can still take.
Okay, then that's one news for all our viewers today. So that please follow up and see if you have not done your insurance, better get it done because as of today we don't know where our health status stands. So it's better to be safe than regret later. So we have had so many talks, we have had so many question answers answered from our public. In short, I would like to invite Dr. Sanjeev Rao to summarize everything that we have just spoken of.
And the specialist can finally.
Yeah, I will ask each one.
Yeah.
I'll do that. I'll talk to each doctor later. Yeah, I would like to ask Dr. Sanjay Rao to just summarize a little. Yeah.
Okay. Now,
Doctor, you're on mute.
Sir, you are muted. Yeah.
hello. Am I?
Yeah, yes,
audible?
doctor. Yes, doctor.
Diabetes is a disease of premature aging. All right, what you would expect at the age of 70, you get at the age of 40. Number one. Number two, it is a disease of the present lifestyle. If you go and try to go 2 steps back and do a lot of sensible eating, sensible living, you will certainly mitigate the complication diabetes. Things are not as bad as they were 20 years ago. There are better drugs now, and the focus has shifted from medicine to diet and dietary regulation. And like I mentioned earlier, the closer you are to nature, the healthier you are. One. So you need to be slim and trim. That's the most important thing. Third thing is, if you look at the complications of diabetes, it is all a complication of generally a blood circulation problem, whether it is the brain, eye, heart, lung, kidney, anywhere. It is generally a blood circulation problem. And so if you can control your sugars and the other things that go with it, you should be living a normal life. Third, diabetes is not one disease. It is a disease where the sugar goes up, but the causes are very many. So research is on its way. Definitely try to establish some uniform method of treatment, but we still not got anywhere. The treatment of diabetes is by and large in the patient's hands. In compliance, the other last thing is there's a saying, a way to a man's heart is through his stomach. Similarly, a way to a diabetic's health is through his stomach. So please eat sensibly, eat carefully. Okay?
Yeah, thank you, Dr. Sanjay Rao. I like that. Your diabetes person is through the stomach. So stomach, we'll have to be careful, very careful now. This is very target. We are going to use it in quite a number of places, Dr. Sanjay Rao. It's going to be very catchy for us now.
I usually extend it by saying the way to a man's heart and man's heart attack both is through the stomach itself. So mind what you eat, you are what you eat.
Wow. Okay. We need to capitalize on these statements, because such things only touch people's heart and mind, so that they start realizing what's more important in life. So coming to the near end of our discussions, I would like to call on doctors to get in 1 or 2 sentences to give a take-home points to everybody, some from your field of expertise. What each viewer needs to take home, something that's valuable statement. I would like to start it off first with Dr. Sanjeev Rao itself. Doctor, give us your take-home point.
Eat sensibly. Yeah. Exercise regularly. Don't get fat. Lead a slow lifestyle. There is no need of burning the midnight oil. It is not necessary at the end of the long run. So you live like your ancestors do. You'll be happy.
Thank you so much, Dr. Sanjay Rao. Dr. Vijay Kumar, what would you say? You have to unmute yourself, Dr. Vijay Kumar.
Yeah, again, I would like to reinforce the thought about exercising. Every day, like Manohar said, 150 minutes exercise per week is definitely a very important thing, not only for healthy lifestyle, but also preventing of any kind of chronic diseases. You can also delay the progression of all these diseases. So exercise daily, regularly.
Thank you so much, Dr. Vijay Kumar. Dr. Pallavi, what would you like to advise?
like to say, take care of your skin, proper skin care, keep it well moisturized, and spend some time with looking at your skin regularly. Those who are diabetics, look for any signs like I had mentioned, any dryness, any callosities, painful areas, ulcers. So don't take them light. uh, and also uh, early diagnosis, timely intervention, and will all these points will lead to prevention of complications. So that's it.
Thank you so much, Dr. Pallavi. Dr. Amala Selvam, your final take-home points for our viewers.
See, my advice is any diabetic patient should take care of their family. See, especially what we have seen is diabetic patients, their siblings, brothers, sisters, or their children are more prone to develop diabetes. So these are the people who may develop diabetes in future. So they should start doing proper exercise, maintain a proper weight, like no reduce their tummy. This is very common in Indians. Central obesity, we say. Like no, especially Indians, they are very thin, but they have a very big paunch, and
Yeah.
they should take care of reducing it, dieting before they develop diabetes. That is my message, so that the family lives healthily.
Thank you so much, Doctor. Dr. Shruti, what's your take-home points?
Ma'am, as everybody said, lifestyle modification is an important factor. But I would like to add that a stitch at time saves nine, as the saying goes. It's always better to get periodic examination. As we remember our birthdays, anniversaries, and fond of celebrating it, let mark a date in some month and get a periodic examination of eyes also.
That was extremely awesome. Periodic examination. Dr. Manohar, a lot of things pending for us. Lot of awareness things we have to do now. Periodic examination is one of them. Okay. Yes, Dr. Sridhar, your take-home points.
What I would like to say is, to have a peaceful and a happy life, we should have both health and wealth. So health, as you know, is taken care by the doctors, and wealth management also becomes very imperative, for which insurance is definitely like a boon in disguise. So it is like, as I said, it's two sides of the coins, like, health and wealth. So definitely, please plan your wealth management accordingly, so that you will not be strained, and you do not liquidate your assets, and could definitely have a peaceful and healthy life. So insure early, so that you get good coverage. Thank you.
Thank you so much, Dr. Sridhar. Now, we have heard so many different talks and awareness things. Initially, Mr. Suresh, you were talking about this awareness. Now, at the tail end of this panel discussions, what is your take? ಏನಂತ ಇದ್ದೀರಾ? What you feel about all this now? What is your view on diabetes and its awareness and what doctors are doing?
Well, it's a very clear, message for all. Health is wealth. ಆರೋಗ್ಯವೇ ಭಾಗ್ಯ ಅಂತಾರೆ. ಸೊ ಆ ಒಂದು ಇದ್ರ ಮೇಲೆ ಪ್ರತಿಯೊಬ್ಬರು ಸಹ ಕಾಳಜಿ ವಹಿಸ್ಬೇಕಾಗತ್ತೆ, ಜವಾಬ್ದಾರಿಯುತವಾಗಿ ಇದನ್ನ ಪರಿಗಣಿಸ್ಬೇಕಾಗತ್ತೆ. People have to consider this with a great responsibility, because health is wealth, as I said. So if you have all the wealth and if you don't have health, you can't do much. Or if you it's so important that we are aware of that, and we are as doctors said, exercise and diet, lifestyle modification, all this is so important. And then on top of this, one of the most important thing that as for a common people is lack of awareness. So not see the medication, the infrastructure, doctors, all the knowledge, if it does not reach to people, and if people are not able to perceive this in a responsible manner, due to lack of awareness, then probably a lot of things will collapse, especially the health and society and the development of the country itself, because there are a lot of people who will suffer and have a lot of health issues. So it will not be a healthy country. Is that we have a healthy country. Swasth Bharat, Swachh Bharat anta Modi ಅವರು ಹೇಳಿದ್ದಾರೆ. ಸೊ ಅದ್ರ ಪ್ರಕಾರ ವಿ ಆಲ್ ಹ್ಯಾವ್ ಟು ಟೇಕ್ ರೆಸ್ಪಾನ್ಸಿಬಿಲಿಟಿ. ಮತ್ತೆ ನಾವು ಸಹ ನಮ್ಮ ಕೈಲಾದಷ್ಟು ಇದೇ ರೀತಿ ಎಷ್ಟೋ ಯೋಜನೆಗಳು, ಕಾರ್ಯಕ್ರಮಗಳು, ಈ ವೆಬಿನಾರ್ ಮುಖಾಂತರ ಎಷ್ಟೋ ಒಂದು ನಾಲೆಜ್ ನಮಗ್ ಬಂತು. ಎಲ್ಲ ಎಷ್ಟೋ ಜನಗಳ ಡಾಕ್ಟರ್ಸ್ ಜೊತೆ ಡಿಸ್ಕಸ್ ಮಾಡ್ಬೇಕಾದ್ರೆ ಅದೇ ರೀತಿ ಇದೇ ವಿಷಯಗಳನ್ನ ಜನಗಳ ಮುಂದೆ ತಗೊಂಡು ಹೋದಾಗ when we take it to the public as an awareness program, I think people will become more responsible and people will follow such advices, and we will be a Swasth Bharat and a great country. ಅಷ್ಟೇ ಹೇಳಕ್ ಬಯಸ್ತೀನಿ ನಾನು.
ಇನ್ನೊಂದು ರೀಸನ್ ಸುರೇಶ್ ಅವ್ರನ್ನ ಇನ್ವಾಲ್ವ್ ಮಾಡಿದ್ದು ಅಂದ್ರೆ he is also in the government committee called Disha, which oversees some of the policies from the central government. So possibly we can take and translate some of what we have discussed put into practice.
Yes, definitely. ನಮ್ಮ ಕೇಂದ್ರ ಸರ್ಕಾರದ ಯೋಜನೆಗಳು ಮತ್ತು ಕೇಂದ್ರ ಸರ್ಕಾರದ ಕೆಲವು ವಿಚಾರಗಳು ಜನಗಳಿಗೆ ತಲುಪಲಿಕ್ಕೆ ಒಂದು ಪರಿಶೀಲನಾ ಸಮಿತಿ ಅಂತ ಮಾಡಿದ್ದಾರೆ. ಅದು ಎಸ್ಪೆಷಲಿ ರೂರಲ್ ಡೆವಲಪ್ಮೆಂಟ್ ಮಿನಿಸ್ಟ್ರಿಯಿಂದ ಯಾವುದೇ ಇಲಾಖೆಗೆ ಸಂಬಂಧವಾಗಿರ್ಲಿ ನಮ್ಮ ಕರ್ನಾಟಕ ರಾಜ್ಯದಲ್ಲಿ ಒಂದು ಎಲ್ಲಾರನ್ನು ನಾವು ಈ ವಿಚಾರಗಳನ್ನ ತಗೊಂಡೋಗಿ ನಾವು ತಿಳಿಸ್ಲಿಕ್ಕೆ ಒಂದು ಅನುಕೂಲ ಆಗುತ್ತೆ. ಸೊ ದಿಸ್ ಟಾಪಿಕ್ ಹ್ಯಾಸ್ ಹೆಲ್ಪ್ ಮೀ ಟು ಪುಟ್ ಸರ್ಟನ್ ನೋಟ್ಸ್ ಟು ರೂರಲ್ ಡೆವಲಪ್ಮೆಂಟ್ ಮಿನಿಸ್ಟ್ರಿ, ಸೊ ದಟ್ ಎಸ್ಪೆಷಲಿ ಮಧುಮೇಹ ಪಂಚಾಯಿತಿ ಅನ್ನೋ ವಿಚಾರಗಳಲ್ಲಿ ಇದನ್ನ ಯಾವ ರೀತಿ ಆ ಮಟ್ಟದಲ್ಲಿ ನಾವು ಅವೇರ್ನೆಸ್ ಕ್ರಿಯೇಟ್ ಮಾಡ್ಲಿಕ್ಕೆ ಅವಕಾಶ ಆಗುತ್ತೆ ಅಂತ ಒಂದೆರಡು ಇನ್ಪುಟ್ಗಳನ್ನ ಈ ಒಂದು ಮೀಟಿಂಗ್ ಮುಖಾಂತರ ನಾನೇ ಖುದ್ದಾಗಿ ರೆಡಿ ಮಾಡಿ ಡಾಕ್ಟರ್ ಮನೋಹರ್ ಹತ್ರ ಡಿಸ್ಕಸ್ ಮಾಡಿ ಇದನ್ನ ತಲುಪಿಸ್ಲಿಕ್ಕೆ ಪ್ರಯತ್ನ ಪಡ್ತೀನಿ. ಆದಷ್ಟು ಮಟ್ಟಿಗೆ ಇದೇನಾದ್ರೂ ಇಂಪ್ಲಿಮೆಂಟ್ ಆಗೋದ್ರಲ್ಲಿ ಸಫಲ ಆದ್ರೆ ಇಂತ ಒಂದು ಒಳ್ಳೆ ಕೆಲಸ ಇನ್ನೇನ್ ಮಾಡ್ಲಿಕ್ಕೆ ಸಾಧ್ಯ ಅಂತ ಹೇಳಿ. So I'm very happy to be part of this, and also this ಜನಸಾಮಾನ್ಯ ಬರೀ ಡಾಕ್ಟರ್ಗಳೇ ಮಾತಾಡ್ಕೊಂಡ್ಬಿಟ್ಟಿದ್ರೆ ಇದು ಜನಸಾಮಾನ್ಯರಿಗೆ ಅರ್ಥ ಆಗ್ತಾ ಇರ್ಲಿಲ್ಲ, ಜನಸಾಮಾನ್ಯರಿಗೆ ತಲುಪ್ತಿರ್ಲಿಲ್ಲ. ಸೊ ಈ ತರ ವಿಚಾರಗಳನ್ನ ಎಲ್ಲಾ ಇದರಲ್ಲೂ ಸಹ ಒಂದು ಜನಸಾಮಾನ್ಯರು ಇದ್ದಾಗ ಇದರ ಬೆನಿಫಿಟ್ ಜನಸಾಮಾನ್ಯರಿಗೆ ಮೇನ್ ತಲುಪುವ ಒಂದು ಇದಾಗುತ್ತೆ, ಕಾರ್ಯೋನ್ಮುಖ ಆಗುತ್ತೆ. So this is a very good event, and I'm very grateful that I participated, and thank you for the invitation, and it's wonderful.
ಧನ್ಯವಾದಗಳು ಸುರೇಶ್ ಕುಮಾರ್ ಅವರೇ. ನಿಮ್ದು ಅವೇರ್ನೆಸ್ ಏನ್ ಪ್ಲಾನ್ ಮಾಡಿದ್ದೀರಾ, ಐ ಥಿಂಕ್ ಅದನ್ನ ಸಾಧಿಸಿದ್ರೆ ಎಷ್ಟೋ ನಮ್ದು ರಾಜ್ಯದಲ್ಲಿ ಜನರಿಗೆ ಉಪಯೋಗ ಆಗತ್ತೆ, ಸಹಾಯ ಆಗತ್ತೆ. ಈ ದಿಶಾ ಸಂಸ್ಥೆಯಿಂದ ಮನೋಹರ್ ಅವ್ರು ಅವ್ರ ಟೀಮ್ ಸಂಪೂರ್ಣ ಇದ್ ಕಾರ್ಯಕ್ರಮ ಮಾಡ್ತಾ ಇದ್ದಾರೆ, ಇದು ಇನ್ನ ದೊಡ್ಡದಾಗಿ ಬೆಳಿಲಿ, ಇನ್ನ ದೊಡ್ಡದಾಗಿ ಮಾಡ್ಲಿ, ಇನ್ನ ಜಾಸ್ತಿ ಜನಕ್ಕೆ ಉಪಯೋಗ ಆಗ್ಲಿ ಅಂತ ನಾವು ಬಯಸ್ತೀವಿ. ಇವತ್ತು ಬಂದಿರೋ ನಮ್ಮೆಲ್ಲಾ ಡಾಕ್ಟರ್ಸ್ಗಳಿಗೆ ನಮ್ಮ ಹೃತ್ಪೂರ್ವಕವಾದ ಧನ್ಯವಾದಗಳು. ಯಾಕಂದ್ರೆ ನೀವೆಲ್ಲ ಕೊಟ್ಟಿರೋದು ಒಂದೊಂದು ವಿಷಯ ಜನಕ್ಕೆ ಎಷ್ಟೆಷ್ಟು ಮಟ್ಟಿಗೆ ಹೃದಯಕ್ಕೆ ತಲುಪಿರತ್ತೆ ಅಂದ್ರೆ ನೀವು ಹೇಳಿದ್ರಿ ಸ್ಟಮಕ್ ಥ್ರೂನೇ ಬರತ್ತೆ ಅಂತ, ಆದ್ರೆ ಇವಾಗ ನೀವು ಮಾಡಿದ ವಿಷಯಗಳು ಹೃದಯಕ್ಕೆ ಮತ್ತೆ ಮಿದುಳಿಗೆ ತಲುಪಿದೆ. ಯಾಕಂದ್ರೆ ಈ ತರ ಡಿಸ್ಕಷನ್ ಮಾಡ್ಬೇಕಾದ್ರೆ ಜನರಲಿ ನಾವು ಹೋಗೋದು ಒಂದು ಡಾಕ್ಟರ್ ಕಡೆ ಹೋಗ್ತೀವಿ, ಒಂದ್ ವ್ಯೂ ಬರುತ್ತೆ. ಯಾಕಂದ್ರೆ ಇವಾಗಿನ ಕಾಲದಲ್ಲಿ ಸ್ಪೆಷಲಿಸ್ಟ್ ಅಂತ ಹೋದ ತಕ್ಷಣ ಅಷ್ಟು ಮಾತ್ರ ನಮ್ಗೆ ಸಿಗೋದು, ಬೇರೆ ಏನು ಸಿಗಲ್ಲ ಅಂತ. ಇದು ಇಂಥ ವೇದಿಕೆ ಮೇಲೆ ಎಲ್ಲಾ ಸ್ಪೆಷಲಿಸ್ಟ್ ಒಂದೇ ವೇದಿಕೆ ಮೇಲೆ ಬಂದಾಗ ಎಲ್ಲಾ ತರ ಭಾವನೆಗಳು ವ್ಯೂಸ್ ಬಂದಾಗ ನಮ್ಗೆಲ್ಲಾ ಸೇರ್ಸಿ ಒಂದ್ ಕಡೆ ಹೋಗಕ್ ಬಹಳ ಈಸಿ ಆಗ್ಬಿಡತ್ತೆ. ಸೊ ಈಗೆಲ್ಲಾ ಡಾಕ್ಟರ್ಸ್ ಸೇರಿ ನಮ್ಗೆ ಒಂದೇ ಒಂದು ರೋಗ ಅಂದ್ರೆ ಮಧುಮೇಹ ಬಗ್ಗೆ ಬೇರೆ ಬೇರೆ ಡಾಕ್ಟರ್ಸ್ ಇದರಿಂದನೂ ಎಲ್ಲ ನಮ್ಗೆ ಇವತ್ತು ಟಿಪ್ಸ್ ಸಿಕ್ಕಿರೋದ್ರಿಂದ ಬಹುಶಃ ನಮ್ ವ್ಯೂವರ್ಸ್ ಏನಿದ್ದಾರೆ ಅವ್ರಿಗೆಲ್ಲರಿಗೂ ಒಂಥರ ಎಕ್ಸ್ಟ್ರಾ ಇವತ್ತು ಎಜುಕೇಶನ್ ಕ್ಲಾಸ್ ಆಗಿದೆ. ಬಹುಶಃ ಇದು ಉಪಯೋಗ ಆಗುತ್ತೆ. ಲಾಟ್ ಆಫ್ ಟೇಕ್ ಹೋಮ್ ಪಾಯಿಂಟ್ಸ್ ಎಲ್ಲರೂ ಹೇಳಿದೀರಾ. ಇಟ್ಸ್ ಹಾರ್ಟ್ ಟು ಅ ಮ್ಯಾನ್ಸ್ ಹೆಲ್ತ್ ಆಲ್ಸೋ ಇಸ್ ಟು ಯುವರ್ ಸ್ಟಮಕ್ ಅಂತ ಹೇಳಿ. ಆಮೇಲೆ ವಿಜಯ್ ಕುಮಾರ್ ಅವ್ರ ಡಾಕ್ಟರ್ ಹೇಳಿದ್ದು ಎಕ್ಸರ್ಸೈಸ್ ಇಸ್ ಅ ಮಸ್ಟ್. ಎಲ್ಲರೂ ಹೇಳ್ತಾರೆ ಎಕ್ಸರ್ಸೈಸ್ ಇಸ್ ಅ ಮಸ್ಟ್ ಅಂತ, ಬಟ್ ಹೌ ಇಂಪಾರ್ಟೆಂಟ್ ಇಟ್ ಈಸ್ ಅಂತ ಹೇಳ್ಕೊಟ್ಟಿದ್ದೀರಾ. ಡಾಕ್ಟರ್ ಪಲ್ಲವಿ ಅವರು ನಮ್ಗೆ ತಿಳಿಸ್ಕೊಟ್ಟಿದ್ದಾರೆ, ಎವ್ರಿಬಡಿ ವಾಂಟ್ಸ್ ಟು ಲುಕ್ ಬ್ಯೂಟಿಫುಲ್ ಅಂಡ್ ಗಾರ್ಜಿಯಸ್ ಅಂಡ್ ಗ್ಲಾಮರಸ್, ಬಟ್ ವಿ ಹ್ಯಾವ್ ಟು ಟೇಕ್ ಕೇರ್ ಆಫ್ ಅವರ್ ಸ್ಕಿನ್. ಡಯಾಬಿಟೀಸ್ ಬಂದಾಗ ಹೌ ಇಟ್ ಎಫೆಕ್ಟ್ಸ್ ದ ಸ್ಕಿನ್, ಸೊ ವಿ ಶುಡ್ ಬಿ ಕೇರ್ಫುಲ್ ವಿತ್ ಅವರ್ ಸ್ಕಿನ್ ಅಂತ ಹೇಳಿದ್ದೀರಾ. ಅಮ್ಲಾ ಸೆಲ್ವಂ ಅವರು ನಮ್ಗೆ ಡಯಟ್ ಟಿಪ್ಸ್ ಬಗ್ಗೆ ಹೇಳ್ಬೇಕಾದ್ರೆ ಈ ಜಸ್ಟ್ ಡಯಟ್ ಟಿಪ್ಸ್ ಅಂತ ಹೇಳಿಲ್ಲ, ಬಟ್ he gave us a little more that we should not just take care of ourselves, our family too ಅಂತ. ಅಂದ್ರೆ ನಮ್ ಫ್ಯಾಮಿಲಿ ಜನ ಆರ್ ಮೋರ್ ಪ್ರೋನ್ ಟು ಆಲ್ಸೋ ಡಯಾಬಿಟೀಸ್. ಆ ಟೈಮಲ್ಲಿ ನಮ್ದು ಅಷ್ಟೇ ಅಲ್ಲ, ನಮ್ ಫ್ಯಾಮಿಲೀಸ್ಗೂ ಆಗದೆ ಇರೋ ಹಾಗೆ ನೋಡ್ಬೇಕು ಅಂತ ಹೇಳಿದ್ರೆ ದಟ್ ವಾಸ್ ಒನ್ ಎಕ್ಸ್ಟ್ರಾ ಬ್ಯೂಟಿಫುಲ್ ಪಾಯಿಂಟ್ ದಟ್ ಐ ನೋಟೆಡ್. ಡಾಕ್ಟರ್ ಶ್ರುತಿ ದಾಸ್ ಅವರು she was talking about lifestyle modification and very few points she gave. ಡಾಕ್ಟರ್ ಶ್ರೀಧರ್ ಅವ್ರ ಹತ್ರ one big mantra was health and wealth are two sides of the coin. So how much you're guarding your health, your wealth also has to be protected. So do your insurance and do it as early as possible. So there are so many different varieties. Ali namge ivattu we got educated, sir. So thanks so much to all the doctors present here ನಮ್ಗೆ ಈ ತರ ಈ ವೇದಿಕೆಯಲ್ಲಿ ಮಾಡ್ಕೊಟ್ಟಿದ್ದಕ್ಕೆ ಡಾಕ್ಟರ್ ಮನೋಹರ್ ಅವ್ರಿಗೆ ತುಂಬಾ ಧನ್ಯವಾದಗಳು. ಡಾಕ್ಟರ್ ಮನೋಹರ್ ಅವ್ರು ಎಲ್ಲರೂ ಹೇಳಿದ್ರು, ನಿಮ್ದು ಟೇಕ್ ಹೋಮ್ ಪಾಯಿಂಟ್ಸ್ ಲಾಸ್ಟ್ ಅಂಡ್ ಯುವರ್ vote of thanks to all the doctors would be great.
Yeah. Diet, exercise ಬಗ್ಗೆ ತುಂಬಾ ಮಾತಾಡಿದ್ವಿ. I always tell this, diet and exercise is not for a diabetic, hypertensive, heart disease, kidney disease ಬಂದ್ಮೇಲಲ್ಲ. Diet and exercise is for all of us to practice. Then only we will try not to reach those disease states. The secret to living well and longer is eat half, walk double, laugh triple, and love without measure ಅಂತ ಹೇಳ್ತಾರೆ. So that's my concluding point, and I would like to firstly thank you so very much. You are a very busy personality, and the amount of effort you have put. Usually I am considered like I'll be keeping on at the people to get information, and sometimes they get fed up of me, my team. They are my family actually. After my first family, it is the Disha family, what I have it. So you are doing that to me, and I could see the wholehearted effort what you have put, and that's why this program was so beautiful. And I would also like to thank all the delegates who had logged in, all our panelists, the Disha family it is now. I think we will continue to do this periodically. This is just a snapshot of what we can achieve or what we can do, and it could translate into the government. That is our motto, to take it forward. If we keep it amongst ourselves, it's not going to have much use. And we'll have once in a month or once in 2 months at least, not with so many specialists, 2-3 specialists, and more detailed discussion, not only about diabetes, other lifestyle disease, maybe corona. We'll be in that, and I think I'll be troubling you in our future programs, because you have been so wonderful to us. Thank you very much. Thanks everyone for logging in. I thank RX Events. They have done a fabulous job. Initially, we had some glitch. I think it was my error. And I would like to thank all the team Disha members for bringing up their best and contributing to the success of the program. Thank you so much. Good night to everyone.
Good night, everyone.
Thank you.
Okay, bye. Good night.
Bye, good night.